Take it, we're good.
Yeah. 30, I call this meeting of the Riley County Commission to order. Please join me in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Okay, well, good Monday morning, everybody.
Morning.
Hopefully everybody managed to stay dry, but glad we got some rain. We needed it. Still need a little bit more. So we'll go ahead and start off this morning with some public comments. I'll jump up top here. I don't see Julie on this morning. David, are you got an update instead or?
No, sir. We just got numbers, but Julie has asked a verifying question. We have not heard back from Renee yet.
Okay. John, do you have anything this morning?
No, nothing right now. I have something a little later, but just checking in now.
Okay, sounds good. Do you have anybody here with any comments this morning? Okay, seeing none, we'll go ahead and then move on to commissioner comments. Commissioner McKinley.
Thursday, after our meeting, because the chamber had been here, had some other questions, went over to talk to Darren at the chamber about a local business that's going through a buyout, see what they had questions that they didn't want public. So I went over to talk to them, got some help for them about that. And then Thursday afternoon, I attended the Resilient Wildcat Creek Advisory meeting. They're working on an update to the Wildcat Creek Flood Management Plan. Part of it was noting some of the items have been completed, some of the smaller items have been completed, and making a list of what needs to be attacked next. Then Friday through Sunday, I took a short vacation down to Grand Lake in Oklahoma. My wife's sister moved there last year, and now that we're all vaccinated, we were able to take a visit. It was rained the whole time, but it was still a nice visit. It was a long drive home in the rain. 5 hours driving in the rain gets tiring. But it was good to get out. And they got 2.5 inches. We got, from what I can see, we had 3/4 of an inch over the weekend.
And
we had 2.5.
I had an inch and a half.
And earthquakes?
No, I didn't. I heard
Wichita.
them talking about that, but I didn't notice them down there. That's it.
Okay. Commissioner Folke.
Okay. Thursday, met with several constituents in my office to visit about upcoming issues, including, of course, the mask mandate. I did spend some time in the office answering emails, returning some phone calls, doing some filing and organizing, which is always fun. Friday, met with a homeowner that I know concerning a possible kitchen remodel, consultation and design. So I have to see if that one works out or if I have time to do that. Went over documents on the budget and the upcoming law board meeting on Monday, reviewed the agenda and documents for today's meeting, reviewed the 2021 budgets and numbers to be used for 2022 baseline, which we're going to review today. Saturday, I went to the parade for a little bit at Aggieville, but left before it was over because it was too cold for me. But I was alerted to a possible law enforcement issue over some large gatherings that were being held in adjacent neighborhoods. I heard about I don't know if this is correct, about 1,000 partygoers have been dispersed by the police department, and did see a video of the group, and they were really packed into a yard up on the Tone Street. It was really kind of disturbing to see all those kids together, not social distancing, drinking, jumping up and down, and being like really packed in. So I'm sure the neighbors were not real happy about that either, so. And I'm assuming that that's gonna be discussed today at the law board meeting. So that was very concerning. So just spent the weekend just trying to get things organized and deal with rain and.
Okay, well, me, going back to Thursday as well. We had the March meeting of the Manhattan Area Recovery Task Force, and Linda's on that. Alice gave an update too. So talked on the overview of the latest health orders that are in place. Got some updates on testing, some vaccinations, not just locally, but from around the region. Follow up on a business confidence survey and the creation of dashboard from that, from the Clinton Hills regional discussion, and some other discussions on the then newly passed, because it was signed that day, $1.9 trillion American Rescue Plan. And started discussing lastly on some continued future items and topics for this particular task force. It's getting a little smaller and smaller, I noticed. But still lots of good dialogue going on with that. And believe it or not, we've had that in place for almost a year, believe it or not. We was doing that weekly, and we went to bi-weekly, and now we're doing it monthly, and who knows after that. Maybe someday we might actually be able to have one of those in person, maybe, is what I was actually thinking. So, but that'll be discussed down the road, but we did get through that. Thursday evening, I listened in on another National Association of Counties national membership call. This is a little different than the bi-weekly one that we had. This was specifically discussing the newly signed American Rescue Plan. Our discussion centered around what that means for counties, mostly, obviously parishes and boroughs from around the United States. And obviously, because we're directly in the front line efforts against this pandemic, what all that's going to mean. I get the indication that unlike last summer and fall, deadlines are going to be spread out a little bit, and hopefully it won't be so panicked. It won't be so murky. It won't be developing plans and then having them changed directly on the fly. So lessons learned probably from everybody by that, but it looks like it may be stretched out a little bit and maybe a little bit more workable. So I'm sure all of our people here will appreciate that. And of course, we have a foundation on which to work from. So really, it should be easier and far smoother when those dollars start to come in. Last night, had a conversation with a concerned constituent over the Next Gen 911 system. I know we've discussed this, but be prepared. It's going to be a challenge to work through. And I know we've got 40 or something of those. It's going to be difficult. So
Yeah.
Let's make sure that we're thinking, listening, and using as much care and compassion with this, because it's going to be a big deal. So I just wanted to give everybody a heads up on that. And just to end on something kind of happy, I guess, as I mentioned, I'm not one that believes in moral victories, but that game on Thursday was okay. I think our guys fought. They fought really, really hard. And I was really, really proud of them. I hope we can keep these guys together next year. And I think things are hopeful. They've really put it together a little bit better over the last month, and should be no place to go but up. But really nice to pick up a win against Baylor, because I'm not a big fan of Baylor, but we did good. It's a good way to end the season if you're going to end it the way that we've been playing for most of the rest of the season. So, and for me, that's all I've got. Well, we can do some business, Rich.
First item for business, Commissioner Riley County Personnel Action Form, Christina Thomas, promotion, Records Assistant 2 in the Register of Deeds Office, and then Annette Stark, a step change, reclassification of position as a mother-child health supervisor in the health department. Would you sign, please?
Well, this is- isn't here, but when it's, are we still, is that per pay period? Is that part of the amount? I mean,
The amount on these green sheets?
yeah. It says hour. and it's
Yeah, that's per pay period.
Per pay period, you haven't
Yeah.
changed that format.
Yeah, that'd be a nice hourly rate.
Yeah.
Well, it was in the month column. and
Darn, I should have applied for that.
I know Elizabeth said that she was going to work on changing the
Uh-huh.
form to have it.
Next, I have a Raleigh County Physician Action Form for a PRN AEMT and EMS department. Your signatures, please. Ready for the minutes? The board is.
Everybody ready? We'll go ahead then and start with page 1. Page 2. Page 3. Page 4. Page 5. Page 6. Page 7. Page 8. Page 9. Lastly, page 10. Do you need a motion? Okay.
Move to approve the presented notes for the March 11th meeting.
Second.
Okay, it's been moved and seconded. All those in favor?
Aye.
The tentative agendas look, commissioners.
Good. Did we discuss breakfast Thursday morning for Good Morning Manhattan?
Yep, we're planning on it.
Okay.
Uh-huh.
I couldn't remember.
Yep. Any items for next week's press conference? Okay.
I have none.
Next, we have a little bit of a break. Seeing much quicker than they have been recently. We've been going over pretty much, so.
Yeah.
Danny Holgren and Lee Wolf at 9 o'clock. That got
Yeah, that's what I assumed already.
Yeah, we've got 2:09 to start.
We're talking this bunch. I actually kind of like that, to be honest with you.
Yeah.
you ready to do it? So you can set the tape, please.
Thank you.
That would happen.
So did you watch the finals then Saturday?
Actually, I didn't. No.
Texas has been, well, of course, a lot of those teams have been. One week, it looked like they can't beat anybody. And then, man, they were playing. They were They were hot.
Yeah, I seen highlights. It looks like they put it together or something, but they're always that team that gets a decent seed or maybe a higher seed than they should and just lays an egg like in the first or
You
second.
see,
year.
there's 3 Big 12 teams, or 3.
Yeah.
It was nice to meet you.
Was it knowing if
See you on Zoom.
still not for sure what the deal is with KU at the
I was like,
moment.
nice to meet people in
Yeah.
person. I'm like, I've seen you
I
on
don't
Zoom
know.
for 2 months.
That's what I knew you had seen her probably.
Yeah.
2 guys that were out
You never been friendly,
I
guys.
have not.
I knew you had seen each other on Zoom before.
guys won't be.
Yeah, that's what I heard too.
Both ways, so.
I know, that's what it feels. I'll be back.
You know, try some bread sometime.
Virginia's their entire team's in quarantine, but they're supposed to be done
I'm trying to do.
Oh, really?
by Saturday by the time they play, so they're not having to travel all that far. Duke just gave up, I think. They just threw in the towel. So.
At the start of the season, Krzyzewski was saying, "Well, I don't know why these people put it. Now, I don't know this year, but I don't know this year playing. I've seen the results this year. I know why he did that flag.
Have a good weekend.
Well, you have 2 of your 3 top players opt out immediately. Yeah, that's what's
I think he was going, I don't want to do this.
Yeah, I guess one could really blame him, I guess. I don't know. I'm a Kentucky fan, and it was a rough season for them for sure.
Nice to meet you.
Yeah. I know, I had to pull them away.
So Linda, what brought you all the way from Michigan? Just the position, or had you had any other ties to here?
Actually, I grew up in Hope, Kansas.
In Hope?
Yeah, south of Abilene,
Uh-huh.
west of Harrington. So, and I went to K-State.
Good deal.
My undergrad. So,
Good deal. So you're back home.
oh, no.
That's awesome.
It kind of, I feel like we want to retire back in this area. So, Manhattan is the south.
Oh, yeah. Yeah. Oh, I like Manhattan for, like you, I'm a very small town kid, it's just the right size for a small town Kansas kid. Not too big, not too small. If I want to go to Kansas City, it's easy enough to get there from here. Kind of how I've always looked at it.
There's a lot of talks about it's in for a smaller city.
And
It does in the area does a lot to offer with recreation.
So that's much in Texas, that's still.
being in the middle of the nation, it's
I know.
from anywhere from here,
Good to see you guys actually.
transportation nowadays, so.
Going to hold, but he's got a full
Really,
head of
yeah.
hair.
Then in the reverse for Frank Martin, have you seen him
Yeah.
lately? Holy cow! I didn't.
What's the deal with Frank Martin?
He
Have you seen him? He lost his hair.
had was it cancer?
With COVID.
Start with.
Well, cancer to start with, and then he got COVID too, I guess.
Oh,
And
he
then,
did.
yeah, he
He
looks.
lost his hair.
Really?
Yeah,
I heard that.
yeah. I saw him and I didn't even recognize it until somebody mentioned it, and then I looked again and thought, "Oh my
Are
gosh!"
they in the NCAA? I was looking for a team,
No.
I didn't see it. That
No,
surprised me.
They haven't done very well.
No, they've had maybe 2 really good years, including the Final Four year, and that's really been it.
Well, Brad's doing good.
Hmm.
I watched them last night. There's some good games this weekend.
There was,
'Cause
yeah, that Big
side one
10.
I like to be, and the 2 future son-in-laws were home, and they're sports junkies, and so.
2 future son-in-laws.
Well, I got 3 future son-in-laws, so one's committed already.
Okay.
One's official.
The next one will be official in the next month.
Okay.
The next one after that, probably in a year, so. Yeah. Yeah, so there were some really good games.
Yeah, there was. I watched the SEC final yesterday with Alabama and LSU. I mean, that came down to the final shot was almost in and King popped back out, and LSU would have won, but
Yep, I watched that one as
Yeah.
well. Well, Illinois about gave it away. Boy, they're a big guy. He's big.
Yeah,
The starting big guy.
yeah.
But it was actually the backup that actually produced more.
I think that big guy, he just needs to put on another 20, 30 pounds. He's going to be tough. It'll be hard to deal with.
Their big guy
Yeah.
is already like 250.
Okay, maybe it's the backup guy I
It's
was
the
watching.
backup.
Okay,
Yeah, it's the backup. Yeah,
Yeah.
the starter, he's a big dude.
Yeah.
He looks like a tight end. The other guys on the other team couldn't even defend him. He'd just get underneath and pull his way through there.
Oklahoma State always seems to have a guy, looks more like a linebacker than
Yeah.
a forward. They've always got some big guy that really getting there. But
Their main guy, Kate Cunningham, hasn't been 100%. So,
been up and down all year.
yeah.
What's the deal with him? He seems to be a second half producer, not until they really need him does he ever show up. And I just don't get that
Yeah,
mentality because he is a beast.
I
The
don't
final game, he had, I think, 2 points in the first half and then, I
Yeah,
don't know, 15 to 20 the second.
yeah. Then he'd go down the court and he wouldn't even pass the ball and he'd go score, just because he knew that he needed it.
So it works. Morning, sir. How are you?
Well, lady, how you doing?
Doing well, and yourselves?
Good.
Did you guys have a good weekend?
Did.
Yeah, they're always too short, but it was good.
Boy, sure. Losing an hour on Sunday too. Felt more like.
Yeah, it's messing with me today.
That's I
It
think
usually
coffee's
does.
actually
Yeah.
needed today.
I don't drink a lot of coffee, but I'm drinking some this morning because I'm off.
I felt good when I got up and worked out at 5, but I got here and I was like, ugh.
Yeah, we got that. Doesn't seem to be in Manhattan, but North County, the fog was so thick you couldn't see.
It kind of was a little bit down in my area over there in Northview too.
Yeah, it was really bad fog coming in.
Yeah, I was telling him, because they're kind of impulses. There's a truck pickup ahead of me. And I could just kind of see the outline of it and taillights. They're probably a block and a half ahead of me, and all of a sudden it disappeared. It got so thick I couldn't even see a block and a half.
They're saying thunderstorms this afternoon.
Chance, I think most of it's south, but
Is
I
it?
think they say 6%.
Looked like yesterday's round kind of stuck to the east of us.
I got
Typical.
an inch and a half at my place. So
Oh,
I was
I know we
pleased.
got a lot of rain. Yeah.
I was pleased. Needed it, but I'd take some more.
I hear by the weekend here, you'll start to see everything start to green up. I think.
Yeah, our lawn's
Pretty-
already greening
Is
up.
it?
Yeah. Need to get the creeks flowing a little better and the ponds full for the summer.
But not too full.
Except the pond.
We
I
need
didn't
to,
say
yeah,
the lake, I said the big pond. I didn't say the big pond.
we need that delicate balance still.
You just passed the resolution.
Yeah, yeah, I know. Mother Nature's one of those that doesn't listen to resolutions though, so.
I'm surprised it's been these nice slow rains. Though.
Mhm,
Just
yeah, yeah.
nice soaking.
And it's how much rain and snow they had up north. So,
Did you see Colorado? Holy cow.
oh, wow.
They had 52 inches in a couple of different places.
Well, the interstate was closed at good.
Oh, I believe it.
Good.
Yeah, I believe it.
Some of the early predictions were 91 inches. I heard they announced that prediction. They said, no, this is not a typo. And then it got down to 50.
I mean, that's like
Down
a full
to 50.
Wow.
Only 4 feet.
Another good reason to live in Riley County.
Yeah.
That's what I wanted to check my rain gauge last night, and it got knocked over.
I was smart enough to get
empty.
mine out on Friday
I had-
before the rain.
Inch and a half. That, I don't know where our deficit is, but we're catching up. We usually have that 1 week or week and a half or so where it just kind of rains like this, and usually it's spring. I don't want to say that too soon necessarily, but
Except for 93 when we had those months in the middle of summer.
maybe a little bit of everything that summer. Well,
Yeah. Kansas weather, you never know.
sure. Well, is it too early to get your hopes up about the Royals?
Yeah, I just heard a report. It sounds like in the whatever the preseason is, that league, it's a cactus league. They're like cleaning house.
Mm-hmm.
Oh, really?
Yeah.
Yeah, they say they're doing really good.
This Bobby Witt kid that they drafted a couple of years ago, number 5 or 6 or whatever, is going to be the real deal. I don't know if they're going to be able to fit him in the equation this year, but he's going to be good.
And it sounds like there's a lot of people that are in the know that are pretty excited about the team. So that surprised me. I hadn't been following that closely the last couple of years. Sounds like people got their hopes up.
Not so worried about the offense and the defense. It's pitching. I'm still not sold there just yet. So.
Morning, David.
One of the leaders back that's been there, he's that
Wade Davis. There's several. There's Wade Davis. They signed Erling Santana.
It's one of those when we went to
weekend.
the World Series this year.
Not too bad.
Yeah,
It's one of the regulars that he left.
Oh, yeah.
He's coming back.
Well, they
Sign
we
here.
traded him.
Oh,
Well, yeah.
Yeah, traded him. I think to the Cubs, and that's how we got a draft pick and Solar. I haven't. Yeah, I haven't figured out if he's going to fit into the equation yet or not. We'll see. Morning.
Morning.
How are you?
All right.
Good.
It's good. It's busy. Only gonna get busier, but it's, yeah. I'm just. 21's gonna be as hectic as 20. It's gonna get back away.
Mm-hmm.
Figure it all out.
Are you outside doing something, David? You picked up some sun.
Well, parking cars.
Ah, yep, that'll do it.
I need to work on my legs though.
TMI.
Yeah. Yeah.
Just put it out there.
Okay, on that note, it's 9 o'clock, dude. I don't know how you top that, but I'll let you try. Feel free to demask if you need to. We've got hand sanitizer and wipes up there as well.
Okay, well, in an effort to be efficient this morning, I want to thank everyone for having me here. Danny was going to come with me this morning, but we've got 3 grants due today at noon, so she was finishing those up and going over all the documentation because we didn't want to wait until the last hour to submit it. So she is wrapping that up, but I just thought we could go over, and realistically, while it says preliminary 2020 data, this is pretty much finalized data. There was a couple. The UDS is a report we have to submit to federal government, to the Health Resource and Service Administration, their oversight agency. It's called the Uniform Data System Report. It's everything about Konza Prairie, the patients we see, their age, race, sex makeup, how many providers we have, how many patients we saw, I mean, you name it, everything about it. And realistically, this sheet is our annual measuring stick as to how we're doing and as if our patients are getting healthier and they're improving and if we're continuing to grow. And then we have financial metrics that look at cost per visit, cost per patient, and how all that plays out. Now, obviously, 2020 being the type of year it was, this is going to throw the trending off, but wanted to just kind of give you guys an update and an overview. So we have more of, as we go forward and we do these updates, kind of more of a formal presentation. So you can see the data and how it looks and everything that we put together on an annual basis. So we can go ahead and get started. Actually, what I'll probably do is I can just. So if you see in this sheet can be a little, especially with the way 2020 was, it can be a little deceiving because if you look, the way it looks, our number of patients were down from 2019, 13,213 patients to 13,013 patients. Well, with the way the pandemic was and the way it rolled out, if a patient was seen in December and they were set to have a 6-month follow-up or 4 6-month follow-up, well, if it wasn't a necessity or an emergent type appointment, a lot of those were scaled back. So they might have decided to wait until the end of the year, or we've had quite a few patients that have decided to, hey, why don't I just wait until 21 to do my follow-up? And so it might have just been a phone encounter just to check on the patient, maybe do a medication refill. And so by the standards that we track, that we're required to track, since it wasn't a virtual face-to-face or a in-person face-to-face billable visit, it's not counted, that individual would not be counted as a patient. So it can be a little deceiving on how that looks. But as you can see, the virtual visits have dramatically increased from the prior year. And we hope that that continues. Seems to be the case for patients that makes it more available for them to see their physician, to have a follow-up appointment, or even those folks that difficulty getting out, bad weather days, transportation, or there are people that work 12-hour days and it's not always easy to get in. So trying to make more ways, trying to go to the patients where the patients are and trying to make ourselves more accessible for them. And you see our percentage of patients in Riley County increased, and then kind of slowly increased around our service areas. It continues to expand. We have a few, our main service areas are Erie, Riley, Dickinson, Potawatomi, Clay, and Washington counties. Those are our set. And then we'll see patients wherever they come from. Just kind of an overview. This is kind of a breakdown of all of our patients' age ranges. And one of the things that is a requirement for that we are required to have 51% of our board, the Contemporary Board of Directors, has to be users of the clinic. So, and of that, HRSA wants our board to be a makeup of our patients. So it's like our clinic is patient-owned and patient-run, which makes sense. You know, as a user and a board member, you can see from the patient experience what works and what doesn't. So within that age, that's another reason we track age, sex, and race, because then we try to meet that makeup of our patients on our board. Then there are some specific parameters. They want us to have someone from business and law, and there's a whole laundry list. Then there are some of the things that they require. Tends to get a little difficult, especially with finding board members. Like if they're not a user, which I mean 49% are not, but then if they're in healthcare, which it's nice to have someone in healthcare, but if they're not a user, they can't have more than 10% of their income from healthcare. And if they do, I have to request a waiver, and it's a whole thing. I mean, it's one of those things where, you know, to someone at some point it sounded good, but ultimately to those of us that have to do it, doesn't always work out really well. So this is kind of a breakdown of the race of all of our patients, and we're trying to make it easier for all of this. When patients come to the clinic, we're going to electronic check-ins. When they come in, we kind of give them an iPad, and so they can just go sit down and look at it and make sure everything's correct or fill it out. And then the patients can hit the submit button, and that will all get uploaded directly into their chart. So it speeds up the process. So then when the patient comes back to see the provider, that time of making sure everything's filled out correctly with the nurse or the provider, it cuts down on all that. We've also went to a live scribe process to where each of our medical providers has a scribe, but they carry an iPad into the room and set it down, and the scribe is at a remote location talking to the provider through the iPad. So all that's in the room is the patient and the provider, and that is cut down at least 2 hours to 3 hours a day in documentation and processing prescriptions and all of the busy work that has become in healthcare. And it actually has allowed our providers to spend more time with their patients, but not feel like the appointments are any longer. It's more quality time. So they're able to see more patients a day, and that focus of building that relationship and getting to know their patients, which is huge. It is truly worked out very well. So we want to continue doing that, because really it's about, you know, building that trust with your healthcare provider. And then you're going to listen to what he or she has to say and follow up and, you know, stay healthy. Appointments become easier follow-ups. Then we have healthier communities, save more money, which we all love doing. Then we have this has been added, sexual orientation and gender. We track all of that for patients, and, you know, so we know it's best to provide the care to the patients when they come in, track all their income as a percent of our poverty guidelines. The unknown, and this is a mixture of both insured and uninsured patients. Everyone is asked their income and provide proof of income. They don't have to do it. I mean, if you have insurance, patients with insurance still qualify for our sliding scale, but to be on our sliding scale, everybody's charged the same, but based on that slide level is how much they pay. So they have to, and the unknown are people that did not want to give their income, which is fine. I mean, we have quite a few patients that do not, that come see us, but others that have insurance, fill it out, they qualify for a little bit of the slide, and then others that don't have insurance can fill it out and qualify for reduced payment for the services. This is the insurance status. We actually had a small decrease in our uninsured rate. You'll see that big portion is Medicaid and private insurance, small portion of Medicare. Medicare seems to stay steady. And I don't really know how. It seems to stay steady in the 5 to 7% range, but every year we have patients that are getting in the Medicare age range. So I told our quality and IT staff this year, I said, that's something we need to pay attention to make sure that their insurance status is getting updated, because that's one of the things, all of this data, it only comes out as well as our system is running. So this is a few special populations. Our numbers of veterans have gone down a little last year, but as there is more availability for veterans to be seen wherever they want, it's always nice to be able to provide that support in that gap if they would rather come to us, or if they can't make it to the VA for an appointment, if they just need to get in and see somebody or any one of our services, we're there. So that's been very nice. This is a breakdown of medical only. So you'll see we actually did have an increase in patients and visits on medical. And those are all of the breakout of diagnosis and services rendered. So I think the one positive coming out of the pandemic is we've seen quite a few patients establish care that didn't have primary care providers, which is really important. They hopefully now, people didn't always understand, well, why do I need a primary care provider? Not only to follow up on your regular primary care and your physicals to make sure you're healthy, but in the time of a pandemic, if you have a primary care provider and it happens to be disease related, it's easier to get it. It's quicker to get in and get tested initially when you have limited tests and you need a provider's order or something like that. It tends to make that process so much simpler. So we have called on patients and they have decided to establish, which has been good, and it's worked out pretty well. They're starting to see the additional services. So it's nice that people are starting to understand the benefit of the primary care provider. Dental was obviously, with the changes in dental and the limitations, that time frame, we have a very robust dental program between both locations, and we took a big hit on that. And then our dental outreach that we go into different schools around the area, Riley County, Geary County, Dickinson, quite a few schools. We send our hygiene staff in and we do sealants, fluoride, and in some schools cleanings, and then we'll send our dentists like to go out every now and then and just do education for the students and some screening, which has always been really nice. Behavioral health. We did have it's one of the things that we, in tracking this, a lot of our behavioral health side of things were just phone calls checking on patients. We had patients that it would have been nice for a telehealth, but as we know, in our area, high-speed internet tends to be kind of expensive. Not everybody can afford it. And so it is difficult to get consistent service. And it's almost what they need to be able to have a full telehealth type appointment. So providers would call and check on patients and talk them through things if they needed it. But for the most part, we did have a big uptick in virtual visits. But as we go forward, we're going to focus more on increasing our capacity to provide telehealth, virtual visits, and also try to assist patients in finding some sort of subsidies or support and education on their end for navigating the telehealth. Because in our health record, we have a portal for the patients that they can access telehealth services, but they need trained on it. It's never as easy as when the techs build it. And then we did also have an increase in our integrated behavioral health, both at the beginning and end of the year, for more of substance use disorder and integrated behavioral health. Those are patients that see medical and behavioral health, and those services run closely. And then we've had a big increase in our substance use disorder. We seem to spend more time, because some of those medications that the patient needs are specialty medications. We seem to spend more time trying to get prior auths, drug companies, insurance companies to cover the medication. I mean, you have a patient that wants to get better, they have insurance, they have all these benefits, but you spend hours on the phone trying to get someone to say, yes, we'll go ahead, we'll pay. Enabling services, just case management, outreach. We had an increase in that. We're adding more support staff for that to find more resources and benefits for our patients, which has been a big help. Obviously, COVID-19 swabs. I think the numbers were higher than this because in the beginning, it was more about just getting out and doing the swabs and not, we weren't, I think we missed a lot. We weren't tracking it. It was just about being there, trying to figure out what we didn't know and do as many tests as we could and do as much as we could. So that was not an enjoyable time. Just a few other services. We are actually in the state of Kansas. We are a Geary County WIC provider. We are the only health center that provides WIC services. And we have an expanded lab, an in-house pharmacy, and kind of a breakdown of a few of odds and ends of those ancillary services. Some information we get from our national association, and it breaks out in what that 1.37 is what we provided in 2020 in total charitable care. And then we extrapolate that from the data we get from our national association, and the numbers by their formula says we generated over 5.3 million in total economic activity and 4.7 million in healthcare savings for users of our credit. And then that was something we added recently. Stole it from another health center. We asked them if we could use it. They said yes. It was we all just really liked it because while it is important that you find the balance between margin and mission, and you have to pay staff, you need quality staff, they deserve quality salaries, but we're just trying to do good all the way, whether in all the care and all the services that we provide, just do a good job and take care of people. So we felt that really fit best. Standing hat on.
Yeah, can I ask you?
Yes.
How do you calculate generated economic activity?
Honestly, we have it on a formula, and I will send you that formula and what they use. She didn't break out that sheet, but our national association lays out the formula that says if this is many patients you have and this is many employees, and they have a figure to take it times in your dollar amount, and that's what they give. So I will send you that specific formula. It's a sheet. And what the sheet shows is actually on a national level too. So you'll be able to see what health centers nationwide do. And then they have it broken down by each state. So you can see what all the health center, what Kansas generates as a whole. So I will email that to everyone.
That's the generation of visits and what that
Yeah.
cost is.
Yeah, patients and visits, and then number of employees, jobs we've created, patients we've kept out of the hospital, out of the emergency room, which is kind of a combination.
Okay, that's real interesting.
Yeah. And that is what she sent, what the other 192 pages are, but.
Oh, that's ours. That's the rest of it.
Oh, okay, that's, I'm like, what did she send?
She sent the 17 pages she was supposed to.
So, yeah, that's pretty much the non-pandemic related 2020 in a glance. Everything else was lighting everyone's hair on fire and a few chickens with their heads cut off running around trying to sort it all out.
A few? Phew.
Yeah.
Okay, I like the breakdown. I had a chance to visit both facilities last month. I would urge everybody to find some time to do the same. It's really good. It's really good.
Yeah, our focus going forward this year is I'm on our state and national legislative committee through our primary care association. We're hearing a lot. There's going to be, the current administration is high on community health centers. So there is already probably going to release early this summer grant notices for us to apply for capital expansion. Large dollar capital expansion, usually minimum $500,000. And so what we're going to start to do is focus heavily on our expansion efforts in Manhattan, looking for areas of land to build a building and expand what we're doing. You know, what we're finding, we've started recruiting heavily physicians. And I think in the last 2.5 weeks, I've interviewed 11. And there's only been one experienced physician from Kansas and 2 soon-to-be new grads from Kansas. Everyone else is from out of state. What we're finding is there's a lot of people wanting to come to a community like Manhattan or like Riley County and live in an area that has a lot of the amenities they need, or their amenities were within a couple hours, but it's not so populated. I think when these people that live in certain states or large cities, when the pandemic hit, they felt very closed in. And we're seeing a lot of people they want to get to a place like this area and move and raise their family. So we're really excited. I mean, there's a lot of great quality candidates. So we're going to focus on expanding our efforts and what we're doing and trying to provide more services and become more available to folks of Raleigh County and Manhattan.
I think with the university putting a public health degree program into place, I think you're going to see a lot more centered people that maybe are here and want to stay here instead of coming from someplace else.
Yeah, I was really excited to see K-State start to add with the PA program and the public health more health-related degrees. That's going to be a huge help.
Okay. Any questions, observations?
Yeah, thank
Well,
Thank you
for
guys.
your time,
It was great to see you.
And we'll get together soon and chat.
Yeah, sounds good.
Okay.
Have a good day.
Okay, you're up, David. Personal information aside.
You tell me that I don't talk enough. Then when I talk,
And you heard me talking about that balance thing with creeks and rivers earlier. Yeah, that's
There you go.
where we're at.
living no matter what I do.
Just like at home.
Yep.
Exactly like at home. And at EMS.
See, you're already used to it. You're already used to it.
We're just making you feel at home.
Yeah.
Absolutely great. Morning, Commissioners.
Morning.
David Adams, EMS Ambulance Director with my monthly updates. Starting off with operations, February we had 362 calls for service. Just a little lower than what we were this time last year. But we ebb and flow throughout the year, and then with COVID, we've seen quite a bit more of that. So, but it's still a pretty busy month. 17 calls in North County. We average about 19 and a half calls a month up there, so just slightly under, but nothing big. We'll turn around, we'll have a 22, 23 call month here next month or so. We'll be right back normal. I continue to work as part of the command staff at the EOC. My title on the organizational chart is the operations chief. So, Julie's right-hand man, if you would, but very much a group team effort in that regard. There's as a lot of you guys are aware, there's a lot of us working very hard. So, our department will start to meet in person, following all regulations and recommendations. We had our first supervisor meeting in person, 6 feet social distancing. We were still in masks, doing all of that. And then under education, you see that we had our first in-person class last week as well, advanced medical life support, in mask, social distancing, all of that. So we're getting some good interest in our open PRN positions. So we hope to push that out and start doing testing on that towards the end of the month. Just for some of your background knowledge, the way we do it is we post the positions, then we invite those persons into a written test. And the test is based on their certification, EMT, advanced EMT, or paramedic. And it's a general knowledge test that we put together using some national standards, if you will. So we grade those. They have to have a grade of 80% or higher to move on. They're then invited back for in-person hands-on testing as well. This is where they will do some skills testing based on their certification levels. It also gives us a chance to kind of meet some of these persons, because we hire for aptitude, but we also hire for attitude. So, and those are an important mix. And then on that same day, depending on the number of people, we may go ahead and do interviews on that day as well. And then we'll make offers based on that. So, so that's coming up. We'll start that first process, the written, hopefully at the end of the month. So, any questions about that?
Not directly that, but you're all vaccinated for double, I mean.
Yeah.
I thought you guys were in the first phase.
Yes, all of our staff.
They elected to that, right?
Yeah, so 30 out of our 30 full-time staff, I believe 27 are completely vaccinated. One will be here soon. And then we have one who has opted not to based on religious preferences. And then we've offered it to all of our PRN staff, our 15 that we have. And multiple of those have taken us up on that, but they work other jobs as well, and they may have gotten it from their other employers. So yes. So other thing under education, our staff are still working on their regular training calendar assignments. So that's pushed out, and they're working on that on the back end. Lastly, community outreach. We are still assigning crews to Potter Hall to help in that monitoring area for persons for their 15-minute wait time. We have also, K-State has had one large vaccination clinic that they did at the rec complex, and we sent a non-duty crew over there. So what we did, we sent a non-duty crew to that one, and then on that same day, it was a booster shot day for us. So I just had one EMS person there for that, since these people have already had their first vaccine. But we're still very much involved in that, and they're helping us. Some days we pull one of the persons from inside out to help us with parking cars and things like that. So we are still performing homebound or in-home vaccinations for the homebound. It's a pretty arduous process. But Alex Prossman, who is our clinical coordinator, is kind of running that, if you will, working with Aaron and the IT department, compiling all of those lists, and then setting up the schedule and and using our county vehicles to go out and vaccinate these people as best we can. We've notified our staff that we're going to start opening up some public relations events on a case-by-case basis. So in springtime is when we get a lot of requests for events, maybe from daycares wanting us to come out. Different organizations have events, and they'd like us to be there, and it's good PR opportunity for us to tell the people who we are and what we do. So, but we're going to start those back up again. And then lastly, the health department asked us to make some changes in the Families and Child Resource Center. We have 2 offices over there. Josh and Alex both have offices there. And then we had 2 rooms there that we were using for supply closets, just because obviously of our space. They've asked us to move some things around to kind of better accommodate them. So our staff are working on that now. So thank you to the Public Works Department. They're helping get some locks changed and some keys made and things like that, because we need to lock up some of our supplies, obviously. So, all right, and then lastly, here I have our breakdown of our master operations. So this is a breakdown of the different units. 362 calls, as I spoke about. You see the ones, medic 12, 10, 13. Some of those are mainly event standbys that we've done. There have been a couple of days where we've had multiple events going on at the same time, particularly with K-State. That's why you may see Medic 35, which is one of the supervisor vehicles being used at that. We send one person over to a track and field event, indoor track event. So that's why you may see some of those in there. Call volume based on the day of the week. And then call volume throughout the month at the different times. So, do you have any questions for me?
Questions, observations, anybody? Okay.
Okay.
Thank you, David.
Thank you, David. Have a good week.
You too.
Okay, John, it's time for the public press conference. We'll give a public notice is what I'm assuming.
Yes.
Okay.
We're ready.
Yes, we are.
John Allerman, Public Works Director. I have a public notice on structure repair project on Mineral Springs Road scheduled for this morning. Project's located about 1/10 of a mile south of the Mineral Springs Road. Mineral Springs Road will be closed through traffic during construction from the Mineral Springs spur south to the end of the county maintenance. Project is expected to be completed by Friday, weather permitting.
Is that going to actually start today due to weather, or?
If it was up at the office, no. If it was down here, maybe. I didn't see any of one of the bridge crews on the other side of the complex, so I didn't see if their equipment was moved out or not. And I didn't get to talk to any of them before I came down. So.
Okay. All right. Well, weather permitting. That's how it works. Okay. Thank you for that update.
Thanks, John. Next commissioners, we're going to break till 9:45. Julie Gibbs.
Okay.
She survived her.
Oh yeah, that was at 8:30.
Yeah.
Yeah. Oh, I'm sure it was fine.
She comes in beat up.
See if she's still alive, right?
Yeah.
Oh, I wouldn't want to be doing that.
Question for you. What's the new PA program? Also good name, medical. Doctor's office.
That's a Stormont Vale project. Is that
It's all the
construction?
same, but in the same, or is that kind of the same spot? Or?
It's kind of in the same spot, so that building, that they're building, where you see that construction, that'll be Stormont Vale's clinic.
Oh.
And then the actual physician's assistance program is in the Carl and Mary East building, which is right across the street. They're in that
Oh,
research
one's
park.
already made. Oh,
That's already there.
okay.
So-
They're not- That's a new building. That's,
And actually in the Carl and Mary East building, there's a simulator that they'll be using for the physician assistants. But then in that clinic, that's for my day, will have to be, so they'll do internships, we training. Yeah.
My brother's called construction.
How you doing, man?
Education.
Don't think over.
But
Missing out on anything?
Yeah. It says Havelock clinic.
yeah,
so
that's,
that's-
they do a lot of work. So,
Okay, yeah.
you know, they're- and I'm pro for it, but once you get into hospital, there's always something people fix.
So
And
absolutely,
added and rearranged.
yeah. We're excited with it. I mean, in our whole health and human services college, and the public health, see, that's a bachelor's degree that we're starting off now
Oh.
for public health administration. And some graduate degrees, some of them do health and human services and some are actually through the vet school because of the tie-in with the infectious disease and public health. So that's another, that is a new. It's exciting to see the shifting, you know, where are the jobs of the future.
Yes, I like it, that's what. Small, but small. They sell your change. You need this, no, now that we can. But it's working, we do this, that's what we need this.
Definitely changing, so, yeah, but it's kind of exciting to see that construction, so.
Yeah.
It'll be fun to see all the constructions finished too.
Yeah.
We had roads torn out and parts of that. It's good as gonna be torn up.
Oh, yeah.
North Manhattan.
Yeah, they're at Bridge. People have done, moved that.
Yeah. But, you know, as, so that's what they fix them all, but, you know, just.
Yeah. Do that.
More lanes in there, so they can go traffic. Good thing we have planners.
Yeah. Uh-huh.
Oh, really? Yeah.
That happened to me one time.
Well, no, she showed it to you.
That happened to me one time. What was on?
Oh. Here's what you told us.
Well, hopefully it worked well enough that she could get it. Or was she there in person?
I know, she was doing. No.
Yeah, they're just sharing information.
It's a Microsoft Office product. Work with her on it. That's simple, just there.
And he couldn't get in with me this morning.
Oh, really?
Yeah. That was, I couldn't get through it.
Yeah, that's technology.
Yeah.
Technology's fun until it don't work.
But I just like that.
So maybe we'll have to do that one again.
And so we break down then.
Survive. You survived. She said she survived.
Okay, she's in one piece, so we're good.
Only here today.
Well, yeah.
What did the tenor of the reception seem like, or did you tell?
They came about.
The what?
Yeah, I did, yeah. So,
At least they have the advantage of giving us that.
Yeah.
So we can see exactly. So did he seem like he had seen that? Yeah, I just.
they went after the phases. Why? they budge on the middle. Yeah, it's the same.
Nothing consistent, because I didn't see him.
No. Yeah.
Okay.
Just that they won't see the guidance, so there's really good CDC
There's also.
Well, yeah.
There's also.
guidance. Right.
Yeah.
It changed.
Quite consistently too.
Online.
Yeah.
Okay. Good. Okay.
Yeah.
See, next doors.
No, they don't. Yeah, they do, really don't. That's a hard thing to do. True.
Okay.
There you go.
What's the wildcat region that's coming up on here, do you know?
The,
On the health grant, shows the wildcat region and the health department. It's under the grant itself.
yeah, Julie will be able to tell you that, the parameters, we got that Wildcat region, you said Wildcat region, first thing I think of was the Wildcat watershed.
Yeah.
First thing my mind went to.
Yeah, this is, yeah, it's under.
That's a dialogue that can go on and on and on.
Not a wildcat.
Yeah.
Okay, it is 9:45. It is time for Julie. Just as a point of procedural here, I need to move that we recess as the Board of County Commissioners and convene as the Board of Health.
I'll second.
Okay, that's been moved and seconded. All those in favor?
Aye.
Aye. Go ahead, Julie.
Good
Good
morning.
morning.
So I'm here with our request to apply for fiscal year 2022 KDHE 8 local. This is our big package for the year. It includes our childcare licensing, chronic disease risk reduction, family planning, our immunization action plan, maternal and child health, includes state formula, local public health emergency preparedness, and then also our regional public health emergency preparedness. So there's actually 2 attachments to sign off on this, and this is due at noon today. So I'm hopeful for approval that we can send in this application.
Julie, the question I had, what is the Wildcat region? What is
That
that?
consists of, so it's Geary County, Pottawatomie County, and Riley County, and Renee is part of that. She oversees that part, so that's why it's separate from the other, because it is a region. So that's our emergency preparedness, and they really work together as a region then for emergencies in the area. So
Okay.
to get prepared for that. Yeah.
If I'm not mistaken, it's been a pretty solid number over the last couple of years, correct?
Yes.
Yeah. Okay.
So that 30,000 is, it's not itemized like the health department is. Is it just for coordination, or are there services there or Wildcat or what?
Yeah, I believe that goes to part of Renee's salary, since she oversees the Wildcat region. So
Okay.
that's what that is for.
Okay.
Is there anything else? It does require a motion.
I would make a motion to approve the grant proposal for the health department.
I'll second.
Okay, it's moved and seconded to through with the aid to local for, I guess that's fiscal year 2022. Any further dialogue, questions? Okay, seeing none, all those in favor?
Aye.
Thank you.
Thanks, Julie. Several places.
All right. Oh, yeah, you're not kidding.
Yes.
Okay, here we go.
Guys be able to take a copy of that.
Yeah, I knew it was due at the
Yeah.
end today.
Oh, there's the first one.
Thank you. Thank you.
Thank you. Next, Commissioners, we have the bid at 10 o'clock.
In the meantime, I'll also move that we recess as the Board of Health and reconvene as the Board of County Commission.
I'll second.
Been moved and seconded. All those in favor? Aye.
Thanks, sir.
Just two.
Fishing limit. Or Julie?
Okay, it is 10 a.m. Time for our bid opening for trash service. Go ahead and start off with the first one of those that we have coming from Howie's Recycling from here in Manhattan. Stuff here. Two sheets here. Looks like the total bid that I see here is for $18,314.16.
Now, is that for all of our agencies or what is it?
That was my question too. What's this
Yeah.
for?
It's for
Yeah.
our facilities, our buildings.
Our buildings here in this complex.
No, for all of them.
All of them.
All of them.
The noxious weed, public works, it's for all of our
Okay.
facilities.
Oh,
So it's
that's all.
9 of
I
them
thought
total.
I hadn't seen that. Just was curious what it was.
I'm trying to remember. Do we do this one every year?
No, that was 5.
Okay, so I was gonna say I don't remember seeing it. I don't remember seeing it over the last couple of years. So that's a total for 5 years, or that's a
That's yearly.
yearly bid for the next 5 years. So
Yeah,
okay,
so
at least you get a 5-year rate on that. Any other questions? Okay, you have to look to the green sheets on there. That's what the
Okay.
information is.
deposit.
Yeah.
How many buildings do we have? You got any idea?
More than 9, so I counted 9 for the trash services.
It depends on what buildings you're talking about, because we have numerous Riley County fire
This
stations,
is-
so lots of facilities.
8, 9.
We have ambulance, and then we have
There's
the
about 15,
ambulance facility up there.
15
15 on
listed
there?
on,
Okay.
15 different dumpsters listed.
Bravo to whoever wrote that, because it's actually pretty legible.
Yeah. Right. Yeah. This is the bids from Howie's Recycling. Total price per year, $18,314.16.
Okay, that's per month per year, right?
Price per year.
That's price per year.
That's-
total.
Oh,
Right,
Yeah.
okay.
for the next 5 years. And then the second one I have is from Waste Management. I think you guys are here in town too, right? And the total bid I see there is for $25,907.40.
Yeah.
Again, this bid from Waste Management, total price per year, $25,907.40.
And it is a bid to send those recommendations back to staff for further evaluations and a recommendation.
Yeah.
I'll make a motion to send these bids to staff for their review and recommendations.
Okay, do I have a second?
Okay, I'll second that.
Okay, it's been moved and seconded. All those in favor?
Aye.
Aye. Thank you, Julie.
Thank you.
And we've got Clancy at 10:10.
Thanks for coming in.
Thank you.
I didn't see how baseball did over the weekend.
They lost the last one. I mean, like 3 or 4.
Yeah, they did. They played
3 for
well.
1.
Okay.
They lost the last game by 1 run.
To Rice.
On an unearned, they talked about it.
Unearned run.
Ninth,
1-0.
top of the ninth.
Rice has got a pretty good baseball program, so
Yeah, they're
take that at face value. Didn't we play down there in the Rice Regional one year?
that we played.
I think it was.
Yeah, that one we played.
It'd be nice to earn a home regional this year. Of course, that'll make your guys' life tough, but
Well, that's
fair enough.
she's having so much fun, she can't leave.
I know, I thought maybe she'd be gone.
I did 2 weeks in itself. Yeah. Still on the turns out.
It's your local government or.
Yes.
I'm making plans to go to a lot more meetings like this myself when it's time. School board meetings, a few city commission meetings, something. Part of the plan. Okay. Thank you.
Thank you, sir.
That's just a copy of it.
Yeah.
Yeah, that's cool.
The current, or no.
You're proud of memorized, don't you? Recite it in your sleep.
I know. Yeah, it haunts me in my.
Can we sign it?
Yeah.
Imagine how we feel. We had 19 of them before it.
You remember exactly what each one of them said, right?
Maybe not verbatim, but close.
Got an idea.
Close, yeah.
It's only been 1 year.
Yeah.
How many years does it feel like?
I've aged quite a bit over this last year. I think we all have.
Yeah. It's like 16.
Yeah, you had spring break and you should have done an extra week. There was a full 2 weeks in there, if I remember. Yeah. Yeah.
Virtual, which I did not. Right. Yeah, yeah. I still think you get more out of that person. It's just a, classes. Strategic communications. Yeah. American University? Oh, yeah, no, sorry. Yeah. No, that's fine. No, I was in TC. Yeah. Yeah.
So she worked Saturday.
Okay.
Yes.
Okay, it is 10:10. We have reached Clancy's time here. I wanted to start with you first in case you had something in advance of our larger conversation, I guess.
I appreciate that. Clancy Holman, Riley County Councilor. Good morning, Commissioners.
Morning.
And again, the discussion item is discussion by the County Commission. If the current City of Manhattan mask ordinance expires, what should any necessary future Riley County local health officer order say about masks? And on what date should that county order end, the future county order? As you know, we currently are under in Riley County local health order 20. That does include a mask mandate in the unincorporated area of Riley County. That would be both rural areas and the smaller cities. It does not cover the City of Manhattan. That's important for you to keep in mind as we develop this, because if the current City of Manhattan mask ordinance, and I'll just refer to it that way, shorthand, that's not the number.
7488.
Go ahead and show off if you want.
I have that one in my sleep too.
But if that ends, as discussion has been at the City Commission level, April 1st or otherwise, the moment that ends, there is no mask mandate within the City of Manhattan. I'm not saying that's good or bad, that's a policy decision for the local governing bodies. I'm just telling the fact on that. If that ends, then there is, for all intents and purposes, there will be some discussion about whether, by virtue of having only a mask resolution, the city has ordinances, we have resolutions, a lot of times that gets lost in the conversation. Same thing, it's local legislation right off the governing body. If that happens, if the City of Manhattan's mask ordinance expires, Riley County resolution governing masks in the unincorporated areas and small cities would not extend to the City of Manhattan. We would not have one across the county. And under those provisions, it's probably what would happen is we would be subject to the state regulations, assuming those remain in place. There's an executive order out there, it's 20-68 from the governor's office that basically provides for that. If there is no countywide mask resolution, then the county and the small, and then all of the county, would have the state regulations on masks. It's also important to remember, just as a final thing, if this board were to issue a mask resolution that covers, say, expands beyond the unincorporated areas and small cities to include the City of Manhattan, it would not extend in Potawatomi County. It does not automatically go to Ottawa to that portion of the City of Manhattan within Potawatomi County, and you have no jurisdiction as the Board of Health in Potawatomi County. So it's not something you can fix by putting an additional provision in the future order. With that, if you have any questions, I'd be glad to answer them. I just want to leave the maximum time to discuss this.
Clarify, which I think is right. No matter what our ordinance is or the city's school, they don't, because we've got a lot of email traffic up. What we have doesn't affect the schools, right? The school board, we don't have the jurisdiction over what goes on at school. The school boards have to make their own rules, correct?
The last I knew, yes, the school boards are outside the coverage, and I just that question. So that's an
Because I've had several emails this weekend. They were saying, "Oh no, what you do?" And I said, "No, I don't believe that's correct."
There actually was a very good, in my view, a very good, well-reasoned Attorney General's opinion that took that view, and this board, the prior board, followed that.
And we actually sent letters addressed to each of the school districts, school board president and superintendents, basically stating,
Clarifying that.
yeah, clarifying that. So,
Yeah, I was pretty sure that was right, but
Yeah.
I've been hammered by it this weekend a few times, so.
Good question.
Does that include Kansas State University, or is that under their rule?
There is no separate group for Kansas State University.
So if we rule for the entire county, that would include K-State, not the schools, but it would include the city and not Potawatomi County, or I understand the airport, because that's in
and ATA,
Yeah.
that's the other one too.
Could the city at any time go back and put in another ordinance that would supersede ours?
Well, in terms, I would say no. I would say once this board rules as the Board of Health, my opinion would be that resolution would be what would control. you would have a possibility of conflict there. But this conflict, I think, was resolved by the statutory scheme. There is no assignment of public health authority to cities over the Board of Health.
Well, the way I understand it in the past, the reason that the city did the ordinance was because the county did not have one. Is that correct?
There's kind of it's hard to describe. I want to back away from exactly saying that. This board did not do it because the city of Manhattan acted to do an ordinance based on the fact at that time, Julie can correct me if I'm wrong here, there were a series of outbreaks within the boundaries of the city of Manhattan. And it made, from that board's position, from that Board of Health's position, it made sense to leave that up to the city if they were best served dealing with it, because that's where I think all the outbreaks were happening at that time.
And
that's going to continue.
And there were several of those that extended over into the Pot County side, which regardless, we have no jurisdiction over.
So that's kind of the backstory on that.
Okay, well, I just wanted to clarify that.
Certainly. Plenty of issues for you to talk about. Congratulations.
Now, can the mass, if for instance, we would pass a countywide ordinance specified to a certain date, could there be exceptions to that, say, in the smaller areas, smaller towns?
Well, it would be governed by what this board decides. That resolution would be something that you can plug in there, however you want to deal with it. Under the governor's executive, most recent relevant executive, you can do less strict things than the state's order if you choose to do so. But if you do nothing, then the state controls. So you could put exceptions in there for about anything you wanted. That made some sense. You do also, under the existing rules, as I understand them, you'd have to consult with a local health officer. You'd have to explain on the record why you're doing that. We just have to, there's no magic to it. You simply, you have to make it clear you're not simply acting on a whim. There's something that you're basing the decision to be less strict than what the state is doing on masks.
And the state regulations run until, and they have a statewide mask ordinance until when?
Right now, as I understand it, the key date for the legislature to do something different is the end of March. That's why some of what's driving some of their legislature's review of the Emergency Management Act, where this authority resides. The other normal legislative deadlines are not really what's driving things. It's the expiration of the governor's authority. The interesting thing is when these were revitalized, because most of them expired, were going to expire at the end of January. And then the legislature, the governor went in and issued an order extending them. But I don't see anything in that extension that covers this work. So I'm assuming that it's still good. The one that talks about you can go less restricted, but if you do, you have to make a record, that kind of thing. And that really, that comes, the obligation to make a record is statutory. I hope that's confusing enough. My work here is done. Thank you.
Okay, the next thing I'm going to do here, as this is the first time we've actually addressed this particular issue, is I'm going to give Julie an opportunity to talk. Let us know where you're at with the health department, yourself, BOCC. I know David's here. I don't know if you want an opportunity too, if that's fine, or he can answer questions. So, and then what we'll probably do after that is I will open up the floor to public comment. And we do have a specific resolution in place to handle public comments here during the pandemic, and we're allowing for 3 minutes of time. You will have to come up and state your name at the podium here, and keep it brief. Don't repeat anybody else a prior person has said. And of course, keep social distancing. We do have disinfecting wipes, everything up here. We do ask everybody to demask. I know that may be problematic in this case, so if you are keeping yours on, talk plenty loud and clear so that everybody here and on live stream can hear you. And we'll work our way through everybody one by one. And then at the end, we'll finalize with the conversation between us. And if we need to take any action, motions, whatever, we'll do so at that time.
That doesn't have to be under the Board of Health.
Does not. So go ahead, Julie.
All right, so we have had many lengthy discussions about this in the OC, as well as, had plenty of emails back and forth from clinical task force, hospital, so lots of feedback on this issue. We feel that it would be better to probably extend the mask mandate at least through the school year, since we're, we have about, I think 16% of our population now vaccinated. We're still working on that. And with that in mind, such a low percent is, vaccinated. Also the fact that, we just released a lot of restrictions from the order. So you have order number 20, which does not have restrictions on those businesses or mass gathering sites. I think that we should go ahead and extend that mask mandate at least through the school year to get us through the school year.
And the date that's been discussed on it, Julie, is May 16th. Is that correct?
Yeah, I think May 16th or 17th. Yeah.
Okay.
17th, which is the Monday after graduations.
So are we ending it like May 16th at 11:59 p.m.? Or?
Yeah.
Okay. Yeah. Okay. Believe it or not, you need to be that technical. So,
That's the exact.
And that's mainly because USD 383 is done at that time. The university will commence. Is that the right term, commenced? Okay. And hopefully by then the vaccination process will lead to a much larger portion pool of our population being, general population, I guess I should say, being vaccinated at that point in time. Is that correct?
Data to see which numbers are.
Yeah. Alice just mentioned reviewing that data to see where our numbers are at that point.
Wouldn't it be just as easy to go to the end of May as opposed to, because it takes a while for students, I know K-State students, to get out of town and, they still have finals, I believe, after commencement. No, not anymore. Okay. But, maybe make it more concise to go to the end of the year or the end of the month of May. But
We could, or set a date now, and then, when it gets closer to that, we could look at extending, whichever way is best.
I like the middle of May date at this point in time. I think it gives community and the region and all partners an opportunity to have a specific date set. I think it needs to be added to 21, or however we configure that. I'm assuming it's going to be a 21 because we've got to amend language to cover the entire city, or cover the city and then the entire county, I guess I should say. So that's what I would be on board with at this point in time.
But the intent now is just to wait and see if the city extends or not. So we I guess we're waiting. Because theirs expired, this 20 expires April 1st, and so does theirs.
No, ours actually doesn't expire, doesn't have an expiration date on it. Theirs does.
This one does.
Yes, it does.
Yeah.
This one expires, I believe.
April 1st.
more at the end of March.
Yeah, I read that one. Yep. No, there's.
March, 1st of March.
I thought that was the city's language in
No.
there, not ours.
I don't think it expires.
No.
We have not said any order that has an expiration date.
The city's expires, but our language in there doesn't have an expiration date. on it, if I understand.
Well, the last paragraph says this order is effective 12/01 March 1st and shall remain in effect until April 1st, 2021, unless extended, amended, or revoked.
Our last few didn't have a date, but this one does.
Okay. I thought I'd seen it in there somewhere, but
Well, that's okay, because it'll get extended out to that May date anyway, so. And keep in mind, regardless of what the city ultimately decides tomorrow, we still have basically a 2-week gap there to work and figure that out. I'm a little bit more concerned with what may happen coming down from Topeka at this point in time. And so that's something that we may have to address and review in advance of that date too, considering that happens around that same time. So that would be the only other thing that I could see being a challenge between now and the middle of May. So.
What about potential spikes in COVID? Do you have metrics on percentages, that type of thing? based on last weekend's influx of gatherings, that could go up. So if you would kind of review those metrics on what may change this whole order.
Yeah, we'll definitely be able to see the effects from this last weekend, probably by next week. For sure. Yeah. I was a little concerned with that too, seeing some of the pictures of the house parties.
I'm kind of wondering if that hadn't already happened and just took everything else that was going on this weekend to bring that to the surface. I don't know. I may be
The
right.
house parties have started.
Yeah.
I mean, they've been going on. But to answer your question, yes, we look at those metrics every week.
Okay.
So we're constantly seeing where we're at with those, with our percent positives, with how the hospital is doing, and things like that. We look at that every single.
And we're looking at it regionally as well. So some of our
Yes.
regional partners in and around the state and what's happening there too, correct?
Yes.
And one thing Clancy brought up is if the city allows theirs to expire April 1st, then our intent is to extend throughout the county.
So we have to.
Is that is that the thoughts? Okay.
Yes.
I think we just amend that language and it just includes the city of Manhattan. I don't have the legal jargon to put that into place. I guess we have to figure it out. But fortunately for us, it's not like we have to do it in a 24-hour, 72-hour turnaround.
Right, yeah,
either. So we got a little bit
there's
of
a
time.
couple of weeks there for us.
And I
to
think that's why it was
whatever
important
we're doing.
to get that conversation out of the way now, rather than waiting for the city to do that and then talking about it. At least we have a general path moving forward. So
And I think it sounded like the city wanted to know, some of those commissioners wanted to know if they let it expire, what was our intention.
That's correct.
That's kind of to let them know that.
And what we've been told, we have not had a chance, we will verify this, but what we've been told is Dillon's East, Walmart, Menards, those businesses, regardless of what happens with city ordinances, that they are going to keep, the corporates are going to keep a mask mandate in place in those businesses. So
Yeah,
we'll
that's what I
verify
assumed.
that, but that's what we've been told. So even if we have an ordinance for the city of Manhattan that's in Riley County, some of those big box stores are going to continue.
The major ones over there are going to probably continue it, especially the corporate owned ones, I would think.
Yeah, absolutely. So I know that's a concern with some of the businesses here in town as well. If you don't have it in Pot County, then you may lose business. People can go over there without a mask. But it does not look like that's going to be the case, but we'll verify that.
do we have anything else? Questions at the moment?
No.
Okay, then what I'm going to do now is go ahead and open up the floor for some public comments. I do know we have Linda for sure, and I don't know if anybody else will pop in at that particular point in time, but.
Morning, Commissioners. I am Linda Cook, Chief of Staff and Director of Community Relations at Kansas State University. And on behalf of our leadership at K-State, I'd like to ask for your support in maintaining the county's face mask ordinance throughout the county and also including the city of Manhattan through the mid-May timeframe. As we've talked about, March 16th is when K-State will have completed all of its commencements and our semester will be completed at that time. As you know, numerous public health studies have shown that face coverings are effective as the first line of defense in curbing the spread of COVID-19, in addition to maintaining the hand hygiene with sanitizing hands and maintaining the social distancing. And as we've all noticed or watched, as a result of everyone's hard work in supporting the public health measures that have been in place, positive trends are occurring in the measurements for COVID. The number of infections are going down. We've been watching it go down here in Riley County. Hospital rates are going down, and the number of vaccine immunizations are increasing weekly, which is a good sign. Now, we do need to pay attention to what happened over the weekend with all the parties, because we are pretty positive too. We're going to see an increase in positive cases again, and we need to just address that and keep control over it. But regardless of that, we are seeing light at the end of the tunnel with this virus, and we don't want to lose ground on the progress that we've made. And that's why we think with the face mask ordinance, it's important to keep it in place at least through mid-May and get us through the semester. And we hear the strong warnings coming from the CDC to also maintain ordinances like the face masks and some of the other precautions. And at K-State, as with many other businesses, we will continue with our face mask mandate on campus, as well as the other health protocols through the semester. We'll see what happens during the summer, and then hopefully by fall, we will be back in what is considered a near normal state of operation. So, but we do ask for your support in looking out for the health of your constituents in the community in maintaining this face mask ordinance at least through about midnight timeframe. Thank you.
I do have one question for you, Linda,
Sure.
while you're here. Have you had a real issue enforcing that at K-State?
The face masks? No, we have not. And we've done surveys to see, because we're in a hybrid mode right now. Some in the classrooms, some online, and we've been doing surveys with faculty. And I'm on campus 2 days out of the week. And it's actually the people wearing face masks and maintaining that order are doing a pretty good job.
I think that's probably going to stay standard throughout this process. Okay.
And then also, like the 16th is graduation, but the non-graduate people actually finish the week before that. Is that correct?
The finals are like, winter semester is they graduate first, then they finish the finals.
Oh,
Spring semester, all of their finals are done. And our commencement, which will be outdoors.
and so it's spread
We
out,
work this
but-
out with the health department so
Yeah.
that we're maintaining the right capacity level, but we're having numerous small commencements.
Yeah.
So there'll be 3 on that Sunday, and then we've got 2 on Friday, 3 or 4 on Saturday, and then 2 or 3 on Sunday. So Sunday the semester will be finished,
Yeah.
and then it's just faculty working on the grades. I shouldn't say it's just working on the grades.
That's the most important part. But yeah, we gotcha.
Any other questions?
I wonder do the dorms close on that Sunday too?
Yeah, there's a move out. Yeah, I think they're typically moved out of the residence halls by the time of graduation. Because their classes are finished, their finals are done, so. And they have a plan set up as we've done throughout COVID, where they, we kind of restricted in time when people do their moving in and out, so we don't have everybody congregating at one time doing the move out, so. Any other questions? Thank you.
Thank you, Linda. Is there anybody else that'd like to make public comment? Okay, seeing none, I'm going to close off the public comment section of this, and then we'll move on to just general discussion amongst commissioners. So I guess maybe the question I'll just start off with this is what do we feel comfortable, and how do we feel like we want to handle this moving forward?
Like I said, if the city were to end theirs, I don't think that's possible. If they did, we would obviously want to extend ours into that. And we're going to have, ours does expire April 1st, so I'm assuming there'll be another one coming in the next week. Yeah, probably next week. So we got a couple of weeks yet to go.
Well, my thought here would be to amend whatever language is needed, whether it includes the city, whether it doesn't include the city at this point in time, which will probably require a 21 because that's been our process. And I like the May 16th date. I like having an actual date in there that says this is where we're at. And it lets everybody know that we're approaching the end of it, whether or not it occurs officially or not. But at least we're putting something in there that shows that we're trying to get to that particular point. And I think all the metrics are going to play out over the next 8 weeks, whatever that is at this point in time. I'm feeling good about that, other than maybe the state, as I mentioned. I think they may throw a wrench into that plan one way, shape, or form. And I'm just cynical enough to believe that for some reason. I'm less cynical that I think we're going to take a slide backwards. We may see a little bit of an uptick, but of course that's going to be with the younger population. So I don't think it's going to affect the severity. It's just going to be an increase in that overall number. So I'm comfortable with that.
And that's what I think keeping it till the students are gone isn't, I don't see it protecting the students. I'm just saying, after the graduation, the numbers,
Yeah.
I mean, we've seen the town changes dramatically.
Yeah.
You know, it's much easier to have social distancing. People are spread out.
I
Once
think,
the students are gone, I'm not complaining about it. It's just a fact that does give us through the summer, see what happens when school starts again in the fall. But, you know, the population reduces, which helps everything.
and I think they're going to see a little bit more of that maybe this year than some years where students hang around over the summer and work. I think they're going to be more apt to head home this year, just doing everything else. I think it's just going to be easier financially, socially, all the way around the board. That, and I might be wrong on that, but that just seems to be a reasonable thought at this point in time. So.
Well, and I would agree with the 16th of May if the numbers remain steady and where we are now. And I would definitely want to include the city of Manhattan, however that gets put into the language.
So should we make an official motion to do that, just to finalize it, Rich?
Yeah, if you guys have a direction you want to go, you definitely need to make a motion.
Then I'm going to go ahead and make a motion that in developing local order number 21, that includes language that includes the city of Manhattan or just countywide, which covers all of it, and with a potential end date of May 16th at 11:59 a.m.
PM.
I need a second.
PM.
PM. Oh, did I say AM? Yeah, PM. Yeah. See what I mean? It's all about details.
Can we put in a statement about if the numbers, the metrics stay level?
Well, I mean, we can always come back and review that
Okay.
date first well in advance of that. Yeah, yeah.
Haywire, we can always
Right.
extend it again.
I think we're going to be
I don't
good.
think
That's where I'm at. But
The speed which vaccines are
yeah,
coming out again.
and you're going to have
Depending on what the state does.
yeah.
But
We'll just have to play that one by ear. So that motion will take a second.
Okay, I'll second it.
Okay, it's been moved and seconded. Is there any other further discussions, concerns, questions? Okay, seeing none, all those in favor? Aye.
Thank you, Valley County Council. Again, just want to ask the board, would you like me to bring back a card that has some track changes to work 20, so you can look at the language, depending on what happens tomorrow at the city.
I think it may be good to wait to what happens to city and maybe discuss it again
where they go,
Thursday,
yeah.
because I'm really not for sure where they're going to go.
Sure.
So
If I didn't ask now, I wouldn't think that.
yeah.
Let's the opportunity to find out.
Let's plan some time during your time on Thursday to kind of get to the specifics of that once we know where everybody's at.
Makes sense.
Okay.
All right. I'd like to go through the second.
Thank you, everybody.
Thank you.
Thank you. Thank you.
Did you have one other item you wanted to discuss, Clancy?
I do.
Okay,
And I can do it.
I think we can do that, yes.
What I have next. I'm thinking part of this, like, one item we can do is the letter that I provided the board to downtown Manhattan. I've had conversations with the executive director of that body, and the reason for this is set out in the letter. We're hearing from those that are involved in the legislature every day. They're, quite frankly, the lobbyists who are talking to, seeing what's going on in committees, and all you have to do is sit in on one occasion, depending on what committee it is, to see the counties really lack some credibility, not just us, but counties across the state. Appear to lack some credibility on public health issues before the legislature, not for the entire legislature, certain committees. And the suggestion has been made, I think it's a good one, to bring into those hearings that we prepare, perhaps some written testimony from business people who've had experience with our health department. It's been a positive one. We don't have to say they're going to agree with us all the time. Quite frankly, we're even offering it as neutral testimony, which keeps them out of the merits of any given bill. That's the importance of asking for neutral They don't have to take a position. They can even disagree privately, but they're just saying that regarding support of local control, this is where we're at. I'm sorry. I'm so used to leaving my mask on. I should take it off. I'll just stand here for a while.
I think we're gonna have to do a resolution on that.
But,
3 minutes, Clancy, that's all you get.
I can. So I would just ask that you tell me if that letter is acceptable. There's some urgency getting it to them today, so it's the packets for BNY's board before their meeting later this week. And all this is intended to do is make the ask, to tell them what we'd like their board to consider. And get that conversation going, hopefully pretty quick.
I have a couple of caveats on that. I did talk to Gina last night myself. Because we meet Thursday morning at the same time, the third meeting, and we have the Good Morning Manhattan thing or whatnot, it's going to be difficult for one of us to be over there probably in person, although I may test those waters anyway. I don't know, but she offered the idea of putting together an email like this that we could all just sign to let them know that, they're hearing it from somebody else besides just her at this particular point in time. So given the dynamics of everything, given the unique dynamics of our community, particularly on the business side of everything, and the struggle that we've had trying to figure out whom out of those populations should be vaccinated or whatnot. This has been a concern, at least for this business district. Others are probably a little different, but thought that just a basic letter just kind of outlining this, which I think Clancy has done a good job putting together, will satisfy that and help along the way.
My question is just what's a neutral letter? That's a letter of support doesn't seem to be neutral. I'm not sure how does that.
You're not taking a political position on anything.
Not a position on that bill.
Yeah.
The idea would be perhaps we get something that's nice and broad, and I can talk to Gina about that. She really wanted an explanation of that very thing. But the key
You're
is
saying they support us.
they support us, and they can acknowledge in their letter. We don't always agree, but we have a good working relationship. That's what we're after.
Okay.
Just to show that we're behaving rationally, which really, as you already.
But Julie and the EOC, and Julie and the health department and the EOC has tried to work with businesses with regional accommodations, and are those discussions, and when they call with thoughts and concerns or anything in between, that they've been visible, they've been able to communicate.
It's just the wording.
It's
Neutral
just because
support is kind of, but
it's the kind of.
up to the legal guys. Tell me
Well,
what.
no, I won't accept blame on the legal profession for this. This is a legislature.
Okay, well.
For them, if you say, this kind of goes to Julie's testimony today, it was very important that she did. She took no position whatsoever, not even a neutral position. So that was neutral, as you don't oppose it, you're not in favor of it. But let me tell you the story about how we interact with our board. That's the idea.
Okay.
It is counterintuitive, right? We support you when we told you we're Switzerland.
So if we're okay with that, let's make a motion to do so.
Yeah, I'll make a motion. We go ahead and send this letter to the board to downtown Manhattan.
Okay, I'd second that.
Okay, it's been moved and seconded. Does anybody have any further questions, concerns, observations? Okay, seeing none, all those in favor? Aye. All three, please.
I'm in your way. While you're signing that, I can go ahead and next item if you like.
That'll work.
That's the owner of the county council. This is the next item is the commission agenda report. We're requesting reclassification of a position within our office. As you know, we have two attorneys, and myself and Deputy County Counsel Craig Cox. And then we have two staff people who've been with us for a while, both an office manager and this position, the incumbent of which has been in since 2006. The job has changed, Mr. Carson, the one filled by that staff person. The position is currently administrative assistant 2. Beginning in about 2015, as we look back on it, Craig and I are working this out. It was obvious that the job duties, the tasks that we have that person perform, currently come, are well outside the job responsibilities of an administrative assistant 2. Those are listed in the card. We'll go into detail with them, but I'll just say they really fit more neatly within a legal assistant position, a position the county does have in other offices. I will tell you too, this is not a change that was requested by the incumbent. This is based on our evaluation and our working with HR, independent of the incumbent, independent even of our office manager, to evaluate the position and have a discussion about whether or not there did need to be a change, and came to the conclusion there was. And the reason that matters is because when it comes time at some point, if we have to refill that position, the incumbent moves on. We're going to need to have an accurate job description so that we don't have to scramble at that time and come up with things. And we think we've been pretty patient, waiting to see whether or not, quite frankly, I suspect some of our reluctance to change this immediately in 2015 would have been based on, well, how do you know that those different tasks are going to be done? I would say this amount of time later after 2015, we're satisfied those are permanent changes to those tasks. And we know it has to go to McGrath as part of the reclassification and standard with any such. That's what needs to happen. We support that. It's very good working with our HR manager. We knew we had to begin that way. And the interesting thing is, as I said, it's important to realize not only was this not the idea of the incumbent only found out after we'd done all that work, and I announced it in a staff meeting that it would be brought forward. She's not neutral in this. But it wasn't something that we were asked to do. It was something that we felt in just honestly evaluating what the tasks are. This is the classification that to us makes sense. It's still going to be your call. We know.
The legal assistant, was all, we already had that job description.
That position.
We already had
that position.
Classification already.
Yes.
Yes, not in
our
office today.
Not in your office, but in the county in general, we had that.
Yeah, it has a little bit different duties than the other legal secretary position, but it's a very similar position.
So the
Same level of responsibilities.
The administrative assistant too, correct? Position then basically transforms into this, and that
Right,
goes
that
away.
goes away. We're not asking for a new position, we're
Okay.
asking to reclassify the current position.
Gotcha.
And I did gather information from the other counties, and this would be in congruent with what is happening in elsewhere as well.
And because I think we went through those hoops and approached it in a factual manner, not trying to land it, but just to honestly say, here are the tasks, is bringing it to, we also did not include our office manager in that discussion, because this is an administrative decision that was appropriate for the deputy county councilor and myself to make. Do we do this or not? Do we make this request? She was not aware of it either, but I will say that she's fully in support of it as well. She will continue to supervise that position, our office manager. It will still be at a lower grade, if you will, as is appropriate within our county structure. It does not result in any kind of internal inequity. It's simply reclassification. It will result in what you see in the card. There's a salary difference. There's compensation difference. We're going to be upfront about that. But it's not anything that's going to cause any kind of problem. I didn't expect it.
Is that increase in salary for this year going to be absorbed within your current budget?
Yes, it would.
Okay.
And we did consider that. Okay. It's a small enough figure that we're comfortable. It can be beneficial.
I did have a question. Maybe you can answer this also. On the legal assistant education requirements, it seems to me like a legal assistant should have some, maybe not paralegal, but some legal education. And I don't know if that is in any of the other positions or.
I kind of, as not knowing, being kind of a layperson in the law side, I also had that impression. But it is consistently not a requirement. It is something that some counties have preferred, not required. And then a lot of it is they get on the job training. So they come in with some sort of background as we've outlined, and then they internally will train them to the expectation that they have. But obviously, there's always be a preference to have a little bit more knowledge and experience. The one thing I was gonna point out.
Okay.
Maybe he wants to, no, maybe he wants to point at that. So my concern as an HR person is that these tasks are already, as Clancy's really alluded to, are already happening. They already have the expectation, but they're not in the current position description. And so if you would not approve the change or to move forward with the change, we would want to look at what tasks we need to make sure that we are having this person do, because we have a position that outlines a certain level of responsibility, and we are saying really in reality, we have this level of task that's required to be done in the department. So that's an important point, I believe.
Commissioner Folke, I want to address your question about additional educational requirements. They're talking with Deputy County Counselor Craig Cox. His experience, because he was in private practice for a significant amount of time, what he found is that if you over qualify in your job description, you quickly have a real problem getting applicants. And so I would say that, you could put a preference, but I don't think there's any real reason for them to do so. I would say there's no need to, because you can control the training, and those kinds of things do not need specific legal training other than on the job, because it's very specific as to what's being done in terms of the task. I mean, it's a good question, but I don't want you to be uncomfortable with that not being part of the description.
Okay, any thoughts? Motions?
Sounds like a reasonable thing. If that's what she's doing more, need to get it classified correctly.
I do think that if there is to be a change, that we probably should need to evaluate that job description and make sure that we're up to task at that point in time. But I'm not hoping Jana leaves anytime soon. So of course, maybe that won't be it. Hopefully, won't
And
be
here I
it.
kept saying encumbered.
Right.
Spoiled the surprise.
That's kind of.
Well, and really that's what we're trying to do at this point, is get the job description to match what the current responsibilities are. All those evolve over time, even in a short period of time from 2015. And so that's what we're asking basically, is if we can take this position description, which we think is accurate and correct in what they're doing, have it reclassified. We're pretty confident in the classification because we have a similar position already in the county with similar level of responsibilities, but we really want to get official.
Okay. I'll entertain any other further discussion or motion. Or no?
I could make the motion. I move the board approve the position change from administrative 2 in the Raleigh County Counselor's Office to legal assistant in the Raleigh County Counselor's Office after the reclassification by McGrath Human Resources Group.
I'll second.
Okay, that was a mouthful. Wasn't it?
Yeah.
That's a motion. Okay. It's been moved and seconded. Does anybody else have anything further? Okay. All those in favor?
Thank you, Commissioners. I do want to thank, again, I want to thank Elizabeth Ward for all the work she put into this as well. It was really a good experience in terms of making sure this is accurate.
Okay, up next is Tammy. We're a few minutes behind, but.
Good morning, Commissioners.
Morning.
I am back with the 2022 budget baseline, as promised last week. I just want to go through a couple of things to make sure with the new commissioners that we're completely clear on the expectations today on setting a guideline or giving guidance on the budget baseline. So the budget baseline is actually going to be the estimate or the expectation of what you're expecting to spend. So basically it's going to be what the final numbers say. In order to get to that baseline, that's where we need your guidance or your approval on how you want those numbers calculated or estimated. So with that, our department heads will take prior year numbers, and then based on what you select as appropriate for the 2022 budget, they'll calculate it. So if you say you want to see a 3% increase or a 3% decrease, they'll start with last year's numbers and create a baseline with that guidance of 3%. Is that clear? Does that help?
I think so.
So,
Tammy's did a great job of explaining it. It's just basically for you commissioners, Catherine had asked me, that way she can send out a notice that here's what the commission has asked all of you appointed department heads, elected officials, and outside agencies to consider when developing your budget, because we don't want to send out that letter or that notice and people expect, that revenues are really good and, send the budget in. If there's a message that, we expect revenues to be tight or we're not sure what the future holds, then you kind of craft it that way. That way people don't come in and have to get as large of deductions as what they may have had. They had more clarity. Years ago, commissioners had a zero-based budgeting where they would say, okay, don't budget any more than you did the previous year. There's been years when they said, well, absolutely will not entertain any requests for any new positions. And so it's to give that type of guidance to all of us. That way it makes it easier on us developing our budgets firsthand, and then makes it easier for you guys to review them, knowing that they're closer to where you want to be. So it's for guidance from you guys, from the budget document, which is one of the most important things you do policy-wise.
I'd say it is.
For the citizens.
So if you look at this on the screen here, for 2021, when I actually sent out the letters and the memos to the department heads, this paragraph right here is exactly what I cited for them to use in order to set their 2021 budget.
From my perspective, I'm looking at something kind of similar. I don't know that we have to freeze everything maybe this year, but something that stays relatively flat, because I don't know where our revenues are going to be, and I don't know how monies from outside are going to come in and play a role in that. And I just don't know where we're at economically at this point in time as we still try to work through and pass COVID at this point in time. I do want to keep no new requests for personnel, but I do want to try to provide something within the budget for our personnel this year. So I just don't think we can do that 2 years in a row in the fashion that we had to last year.
Yeah.
And I still want to keep, if you do need to request a new personnel position along the way, or to refill another one, that we do it in the same fashion that we've been doing it, to come to us and talk to us about that ahead of time. And like I said, the further adjustments may be requested and deemed necessary. I would naturally assume that planning probably for early next year. I don't know where events are going to be and conferences and all that stuff, so take those things into consideration as well. But that would be my base guideline at this point in time.
I'd kind of like to see some percentage, like don't exceed 1%, 2%, something like that. Give kind of a little more guidance than just keep it flat.
Okay.
And that type of guidance, of course, Commissioner, I always caution all commissioners, but especially new commissioners, is a lot of times commissioners like to make that public statement early on to keep the mill levy flat. I don't want to reduce it 1%. I want to increase it, or 1 mil. I want to decrease it 2 mils. To hold off on making those, because you don't know what the value of a mill is yet.
Mm-hmm.
You don't know the expenditure side yet, but you won't know until June the largest portion of the revenue generation, which is ad valorem tax. Because I just hate to see county commissioners, policymakers kind of box themselves in early on, because then when you change from that, after you do have the full picture, it makes it a little bit more difficult. But you guys are free to do what you like.
And I think similar to what you had, I thought maybe not quite as, and I'm not sure how to word it, but maybe not as strict.
Frozen isn't the right word.
Maybe not as.
I mean, if you can reduce your budget and find some efficiencies, that would be wonderful. But we're getting out of kind of where we were at last year, and it's hard to think that you can just stay in that particular mode. But I want to make sure, if anything, we take care of the personnel that we have first, because it was a hard thing to do last year. And the only way I think that we can really do that effectively right now is not to have any new personnel for this next year until we really, really see where we're at.
But we do allow the steps this year.
We'll have to discuss that separately, but yeah, instead of just freezing everything to start with, we can entertain that question and figure out where to go there.
Yeah, steps, and then
Right.
COLA.
Right.
But like I said, that's what I was looking at, a little bit easy,
Yeah.
but not completely.
If you do that 2 years in a row, to me, it's a reduction for everybody, and that's just
one
not.
year, I mean, I've had years, I didn't,
Yeah.
everybody has years. Sometimes things don't work out, you don't get a raise,
But I think the balance there is if we don't add a whole another set of new personnel this year, and we even added a couple of positions last year, and I don't know how those are working out specifically yet, but we need to keep that base personnel in stride right now so that we can take care of the people that we have. I think that's the more important approach. So
And some of the agencies in the budget from last year took some fairly significant hits. So that's something we need to look at. Like the ATA, they took like a $30,000 hit.
no, they gave some money back, which allowed us to free that up. That may or may not be the case this year. It's tricky with them because it's federal funds mostly, and certain things offsets allow them to get that. They got a larger portion of federal, so they gave up the local end on that. So
And I would hate to restrict departments that really need some changes and some personnel specifically. It's important to keep personnel going and not lose them.
So in 2012, this may be more general than you want, but it does say the commissioners at that time set the baseline to be created present the budgets reflecting their departmental needs, being aware of the current economic conditions and the tax sentiment of the public. Now, I wasn't here then, so I'm not sure what was going on at that point in time, that's how they wanted the budget set, but that is kind of what I'm hearing from you guys, but maybe more broad than you're wanting.
And one question that said 1520, it said also what's required to implement a 5-year plan, and he added things, and John seemed to discourage that or something.
Well,
to me, it seems, if they see, and I know capital improvements should be separate from this, is that right? But, if they're saying, yes, but this is what it is, but in another year or two, we're going to need somebody else. We need to, that even we're holding things now, but we can see in the future we're going to need some of that. Is that kind of what the 5-year thing
And
was?
it is, it's exactly that. It's for them to give you some idea of what may be coming and maybe how we need to plan even this year's budget, if it's large dollars, like the RCPD firing range, that coming up. That might have been something that we wanted to know ahead of time, so we were aware, we need to make sure these funds are available in CIP at that time.
Yeah, I think
And
that
that's a
would be
big
helpful.
one, but we do have this RCPD fund, and those are things that we need to be able to anticipate at least within the next 5 years.
Yeah, and like I said, to me, that seems that would be helpful to know.
Keep in
Don't
mind.
just say, this is what we're doing. It says next year we're going to ask for another $1 million for this. So
Right.
Just let you.
Keep in mind, we're working on an update on a comprehensive plan too,
Right.
so some of that will be included in that process as well.
Yeah.
And this hardware refresh, that's another really good example. We know it's coming up in 8 years, so
And we
we've
would
been
put
putting
aside
away
so
so
much
much
each year.
each year to just know that it's there.
Yeah.
So those are the things that they should be bringing to let you know that that's what we need to look at.
And like I say, I think that's helpful to know ahead of time.
Reserves is a good way to do that.
Go ahead.
For that strategic plan column that Tammy discussed last week, that's really what it was. It was department's future personnel needs, really, because as you said, all the capital stuff, Tammy does a very good job of communicating with department heads, and they get their extended, outlook. Election equipment that we spent over $1 million, that's a prime example. I've been telling commissioners for 5 years, put money away, it's coming, and it's going to be a big dollar amount. And so that's what they did. They knew that was coming up. And so you kind of do that in CIP for the capital needs, but the strategic column was really more for personnel needs, because large capital items aren't paid for in departments generally, except for, of course, Public Works, Road, Bridge. They have some large projects.
I'm feeling pretty comfortable that, we're going to work through this pandemic, and let's face it, we weren't in great economic times before it. But I think as we approach next year in 2023, I think it's going to become a little bit more clear at that point in time. But I think it's appropriate to kind of keep things kind of scaled back, at least for this next year, to see where we're at. And that's fine. If we want to start looking forward and start looking outward, that's fine with me.
The only other thing I would say on that is if you do set something today and you find out once we get a little further into the, we look at more year-end numbers, we look at, what do our ad valorem tax dollars look like being collected versus what we expected. You can make adjustments. This is just a baseline where
It's
we
just a
originally
starting
set it.
point.
And, until it's finalized, we can make adjustments.
I kind of like the 2012 statement that was made, based on current economic conditions and tax sentiment. There's a lot of tax sentiment out there against increases in taxes.
Specific types of taxes on top of regular taxes.
Yeah.
But would you want to include the one about no new personnel positions though?
But start maybe developing a 5-year strategic plan for that. Yeah, I'd be fine with that. Yeah. Tammy's writing all that down, taking a mental note.
She's writing it down mentally.
Yeah. I've noticed she can do that either way, so it's all good.
Well, so you're not wanting new positions to be,
For this year, but start planning ahead.
okay,
Is that what I'm getting?
that's
Yeah.
what
and you're talking 2022 when
Correct.
you say for the budget year?
Correct.
Okay.
Could we say something like only new positions as deemed
Well,
essential?
we're still gonna do the same process where if that comes up, they do still have to come to us. And even last year, Alice's position, for instance, although it's grant funded, it will be a new position and was considered a new position. And not that I have anything against what Alice is doing or what the position's doing for Raleigh County, because it is, but I wanted the opportunity to be able to review that again, and I was kind of outvoted, so we keep this process into place. So, and we added, another
There's some in the
office assistant, and there was one other one, didn't we?
The treasurer, that front lobby person.
Correct. Yeah. So,
Those are essential positions.
right. But those things sometimes along the way pop up, and we have to figure out how to deal with them. And that's why if they come to us, then we could still discuss it. I mean, it's not a
Sure.
set in stone type of thing. But in terms of trying to develop a budget and figure out the actual numbers and then all the line items underneath that, it's just strategic, a way to kind of approach it at least.
And the reason the personnel is so important is because once you hire that person on, it's a long-term extended cost generally. So it's not just that 1-year cost you have to take in mind. You've got that plus whatever percentage that increases every year. So that's why it's so critical to really think about those. But John, I just wanted to be sure, and Tammy, I just wanted to be sure that we were understanding how the board wanted to handle new position requests. I took it that you really didn't want any new position requests for the 2022 budget, but in a strategic column for past 2022 on.
Correct. That's correct.
So for instance, Alice's position, then we shouldn't be budgeting that?
No, we're talking other new ones, like Alice's in the treasurer's office, when I think they'll want to consider those.
We've already considered that. We're already
considered
keeping,
that.
yeah, we already
Any new
voted that.
ones?
So that,
Those positions already approved.
yeah,
Right,
so
okay, approved.
basically Rich has got to figure out how to incorporate that position into this next year's budget. So,
Well, I won't put it in the budget. I'll put it separate for you guys to approve separately, and so.
okay.
So even like contact tracers
But that runs out at the end, and once that runs out, it's no longer funded.
but so does this position.
But we already agreed to do hers.
Okay,
after-
okay,
Yeah.
well, that's where I
Yeah.
was.
And that's where I got into
I
the,
didn't think we were all on the same page. That's why I brought it up.
No,
That's why.
that's where I got into the weeds out on this position. It wasn't that I didn't want to hire it. I wanted the opportunity to be able to review it, but like I said, I was outvoted on that one, and that's the way it goes.
So far, all of those positions that were mentioned have been approved permanently to move forward. They're not in consideration. They have to go into the budget, but they're continued positions.
It's
Except
any,
the contact.
it's any new ones. Say I have another administrative assistant that I want to propose that isn't on the payroll right now. That is not to be considered for 2022.
Correct.
And then to mention to your point, the contact tracers are currently approved for a position through June, the end of June of this year. If they need extension, they have to come to the commissioner's to ask for an extension of that position. Even though they're grant funded.
Correct.
Well, I don't know, John, I think that's pretty restrictive up to our department heads, as far as saying absolutely no new positions in 2022 unless they're, I would like to see them present to us what they
And they
feel that they really need.
They still can.
So,
But this is just trying to develop that budget. If somewhere along the way, like we did last year on several things, then they still have the opportunity to come and say, hey, we do need this position, and we can have that discussion, but we've got to start somewhere with the
Well, I
budget.
know, but I don't want to be so restrictive on the department heads.
Go ahead,
as far
Rich.
as when they
And that's-
develop their budget.
Tammy,
And
that's
that's
kind
why
of
I'm
a quizzical,
confused,
yeah, the
because
quizzical look
we-
on her face.
Yeah.
One second, Tammy,
Yeah.
please. Because we have been so restrictive in the past, I think you've even seen it here, Tammy, where the commission says, don't even present any new staff, whatever you think you need at all. You're saying something different, Catherine. Catherine's saying, if you think you need someone in 2022 that's not currently on the payroll, bring it. Don't include it in your budget, but bring it.
Yeah, right.
Now, previous commissions, when they said no new positions, it meant don't even bring it. And that's what Tammy would put in her paragraph, the
I guess I'm-
commissioners are not gonna entertain any new position.
I guess I'm probably with the latter right now until I know how we're going to take care of the people that we have. I think, to me, that's more important right now.
And so we just need to get a consensus from two or more of you on which direction you wanna go with either what John is suggesting or what Catherine is suggesting.
So just with that, I just want to clarify, in the past, when we said, don't add them into your budget when we originally do, we have a time set. I think it's around May 17th, when we present the actual COLA numbers to you, where Elizabeth would come, and that's when she would request these new positions that are not part of the budget numbers at that point in time, but would become if you approved them that day.
Oh, okay.
So if that's what you need, that's completely fine, because we've done that before, but that's where I'm just trying to clarify, is it absolutely no way at all, or is there, don't put it in the budget, but if you want to propose new positions, Elizabeth will present them on May 17th to you.
Yeah, that sounds reasonable. It's not quite as restrictive as saying absolutely not. So,
I would agree with that.
I can live with that. My point here is I want to make sure that we take, because we weren't able to do it last year.
Yeah.
I want to make sure that we take care of the people that we have first. That's the first priority.
Yeah.
And in order to stay kind of consistent at a very, very large raise this year, I think you're gonna have to trade one for the other.
right, okay.
Okay, so I will give the guidance that no new positions will be added to the budget sheets that Elizabeth is sending out. However, if you have something that needs to be presented, get with Elizabeth. She will present those on May 17th for consideration. Is that
Okay.
good?
I live with that.
Okay, and then other than that, we're gonna go back to the 2012 and have that same statement that says present budgets reflecting departmental needs, being aware of current economic conditions and tax sentiment.
Live with that.
Okay.
Yes?
Mhm.
Okay,
Okay,
so that
that's
is what I'll send out to the outside entities and then within the departments, which will include the personnel statement. Is there any other guidance that you would like to present for approval on the budget baseline?
Tammy, if you would, when you get that wording, just get it to Cindy K, that we
Yeah.
can put it in there. That way they're consistent anyway.
Yeah.
Thank you.
Okay, so the only other question I have on that, which Elizabeth had alluded to when we were here on Thursday, is the steps. So as she told you, the steps, when we first create them, the steps are put in based on the pay scale for the hourly and the exempt workers that are not professional staff. Then we take all of those numbers and we have an average calculation, and that is what would be used as a step, not a true step, but
It's a step calculation. It's to equate the step of those that are hourly
for the professional staff. So that is my question on the step. Do you want us to go ahead and include in our budgets that % for the professional staff? For her to send out to her department head.
See, this is what's tough for me. I want to know what that is first.
It's approximately 3.11%.
Okay.
It's always around 3%. The
Okay.
increment between each step's generally about 3%.
Okay.
Yeah.
And the budgets do go out with this current and then the next, right? So you'll see where they're at and what effect this step increase would have.
Right.
Before, it's always been 99% of the time included in the proposed budget, just like the step for hourly is presented in the proposed budget. That way it's clear to commissioners who has it and who doesn't. It gets too difficult to know who does and who doesn't if it's not consistent across the board.
Well, I understand
Because the
that.
professional happens to be a lot of positions like Tammy's and Elizabeth's and a lot of others kind of higher up in the departments. There's a significant number of staff.
And we separate them all. You'll see there's non-exempt, there's exempt, and then there's professional pay scale that are separated out. So you'll see that these have step increases, and the professional would be based on the average of the step increase. It'll be very clear in the proposal.
The thing we usually leave off is COLA until after we start
Right.
looking at the numbers.
Well, I think it should be included in the proposal so we can kind of see where that would be. We don't necessarily have to approve it. Right?
Correct.
Correct.
That's
That's fine.
So include the step for all employees.
yes.
Well, I think that this is good for us as new commissioners to kind of see all the proposals and how it works, and then we can decide from that point.
Yeah, once we get the numbers, we have what's called a developmental worksheet, and basically it gives you all of the general fund departments, and then a couple of the other funds that are either ad valorem tax dollars or like our CIP fund will be included in there. So it'll show you what we had last year, what we had budgeted, and then what we are proposing this year. It'll give you the percent increases, so you can see those. You can have the personnel separated out from the 3 Cs, so you can see how much personnel changed, how much the 3 Cs changed. Once we have the revenue set, it'll be on the other side, and you'll also see those differences from prior year to current year, which also then will include the value of the mill once that's set. So once that's set, once we have that value of the mill, then we bring that worksheet to you immediately after we have that and really get to work on the numbers.
Okay.
It'd be nice if some of those processes, such as the development of the mill, was earlier in the process, but yeah, that's just how budgeting, that's just how the budgeting, the state budget.
Statutes, that, you know, they get in the way.
Yeah. Guess that's one way of putting it.
Well, it's early. No, it's March, so I think that we've got a lot of
I
time.
do think we've provided a pretty solid direction, and we can make adjustments along the way, so that'll be all right.
Do you have anything else on the personnel side? That's good. All right. If there's anything else, just let me know, but I'll be getting this out immediately so that the department heads and the outside entities will be aware of it. Elizabeth will get the rest of the budget sheets ready to go to the department heads, and we'll keep working on our process.
Thank you.
Thank you.
Thank you. Okay, Amanda. We're way behind here right now. Is this gonna take a long time?
It's gonna take several hours.
Okay. Because if it is, you're gonna have to come back, because 2 of us have a law board meeting this afternoon.
We're gonna make this work.
Okay.
No problem. I mean, it's one of those things that could take several hours, but we're not going to do that.
You say planning and development 101, I'm thinking a class.
Yes, it's a very, very basic introductory
Okay.
class, so. Let's see. So we're just gonna- I don't have like a fancy PowerPoint, so.
Oh, well, in that case, we definitely got to redo it.
Right. I'm gonna keep it simple.
Okay, sounds
All
good.
right, so good morning,
Keep it simple enough
commissioners.
for
Amanda
commissioners to
Sterling,
understand.
planning director. I'm here with just a very basic introductory planning development 101, as I've been calling it. Again, I had hoped to get this before you a little bit earlier this year, but here we are. It kind of is what it is, but at least we're here. I do like to do these sorts of things, especially when you have newly elected officials. Plus, I think this kind of thing is always beneficial for I'll tell you, most anybody as well as the public, you know, because I do find that often, and I'm already clearing the room.
No.
I'm teasing. I find often that people don't quite understand what we do, and there's kind of a preconceived notion of what we do. So I do like to, you know, I'm very big on, again, the customer service, the being transparent with what planning and development does, making sure people know they can come in anytime and talk to any one of us. I know things are a little bit funky right now with COVID, but we make it work. So obviously all of you know, but I just wanted to talk about, for the benefit of the millions, I'm sure, who are watching this right now, where we're located. We're located on the second floor of Riley County Office Building, second door to the left when you come up the stairs. We are open to the public. We've kind of reopened, if you will. Our door is still shut, but we are open. We do require anybody coming into our office to wear a mask. We don't want more than one person or one, you know, group of, you know, related group of people in our little front reception area at one time. So on the sign on the door, if there is somebody already in there, we ask, you know, the other folks that maybe wait, you know, outside the door, we'll come fetch you when it's clear. Our staff are doing their best to take people into their offices, or you know, scheduling meetings, and if we have them into a large conference, we really bring people in their space. So kind of as I already alluded to here, these sorts of things, again, I can either say too little or too much with a planning and development kind of background. So I'm going to err this time on the caution of saying a little too little, if that makes sense. And it is my thinking over the next couple of months to bring each of my staff members in to be a little bit more specific about what they do, you know, answer questions, give you more details. So I'm going to keep it kind of high level here, so we're not too bogged down, and I don't overwhelm you guys with too much information. So this is our current staff. Here's who we currently have in our office, and their titles. As you know, we folks did approve an as-needed clerical assistant for our office, and I appreciate that. We have a conditional offer out to one of our applicants now, and am awaiting her background check and her test, all the required documents that she'll need to do and fill out. But hopefully we'll get that'll be done this week, and we'll get word that that's good to go, and we'll get her started in the next couple of weeks. So we're really excited about that. I know it does say as needed for her, and I think we talked a little bit about that when I was first requesting this position, but we do intend for it to be daily in the mornings in our office every day. So we'll of course, I know as needed is up to 8,000 hours, so that will, you know, we'll definitely stick with that that limit there, but it is the position we would like in our office every day. So here are our services, and this is basically what we offer to the public. This is not in any way, shape, or form everything we do, and we'll talk more about that in a minute, but these are the main services we offer to the public, to the general public. Let's see, you know, just other things. We also collaborate, coordinate with several of the cities, of course, the city of Manhattan, we have an interlocal agreement with for a lot of different services, and our joint urban area planning board. We also have contracts with City of Riley and City of Randolph for floodplain management services and zoning enforcement officer services. Of course, we coordinate with Fort Riley and other regional agencies as well on, you know, regional planning and other long-range planning. So there's a lot of different things that we do in planning and development. And again, I'll go into a little bit more detail on the upcoming slides, but if you have any questions, please let me know. But I don't want to get too bogged down with details now, because again, I do intend to bring individual staff members to you folks for more detail over the next few months. So here are the planning functions that we offer, and of course, most of you are familiar with that because Bob Isaac, our planner, does come before you quite often for approvals for various land use reviews. So current planning, of course, is our permitting, is our land use review approvals that go before our various planning boards, our Raleigh County Planning Board, Board of Zoning Appeals, as well as the Urban Area Plan, Manhattan Urban Area Planning Board, if it's in that urban area, that they need to look at it as well, and both planning boards will take a look at it. And then it will come to you folks for final decisions, for review and final decisions. Long-range planning, of course, is the things like our regulations, where we've been working on the update to the land development regulations for a few years now. And that we'll have done in the next few months. So that's like a long-range planning effort. Our comprehensive plan, our Vision 2025, that's a long-range planning document, of course. And then other long-range plans that we might have. And these could be regional plans or things like that. Anything that we're looking out over a horizon and kind of planning for the future in some entity or some form is our long-range plan. Environmental health functions. So these are all the different things that Perry Piper, our environmental health specialist, does. The private wastewater, the on-site septic systems, he does everything, for new systems, repairs, replacements, everything from, of course, getting down in that septic test pit and evaluating the soils, permitting to the inspections, all those different sort of things for private systems and then private wells. He does the inspections and permitting for those as well. And water testing, he does those. And we also do water testing. The fellow from Potawatomi County brings those over to us as well. We do that for them as well. Environmental system evaluations, that is basically when a home is being sold. Someone can request that be done, and what Perry will go out and do is basically assess the health of the septic system, the wastewater system, as well as the private well. He might also, if it's on public system, he'll check those connections, make sure those connections exist. He'll also assess the tank itself and all of that. Let's see. And look at files and whatnot, just to make sure the system is healthy. He has found some recently where they're either failing or there's a component that needs to be addressed before it gets, before the sale is complete, that kind of thing. Because of course, anytime we find a system in need of repair, it needs to be taken care of. He does a lot of code enforcement, of course. He also does septic installer caller training and licensing. And of course, that's all in addition to the different calls and questions he fields and a wide variety of other things that he'll do, not necessarily on a daily basis like these are, but just other little things that he'll take care of. Building and floodplain, that's Steve Higgins, our zoning enforcement officer. Of course, he does the building permits and the inspections in our office. He is our floodplain manager, so he keeps the regulations up to date and the maps and everything. That's a joint effort, of course, with FEMA and with the state. And as you folks probably know, there's a couple efforts going on right now to assess the maps, not just ours, but statewide. Assess the maps to make sure if any regulatory updates need to occur, that those happen. At this point, we're still waiting to hear from the state if there's any in Riley County that will be impacted with these two, with the Blue Custom and the Upper Kansas, working on those. So Steve, of course, is very involved with all of that. And of course, he does the development permits as well, the floodplain development permits. Mobile home park licensing, lots of code enforcement. Code enforcement definitely keeps him very, very busy. And then lots of record and research with all that as well. And as I mentioned before, he serves as the floodplain manager for the city of Riley, as well as the zoning enforcement officer for the city of Randolph. Administrative functions, this is Lisa Daly, our administrative assistant too. And I'll tell you, I struggled with how much to put up there. But but I kept it just kind of the big categories, kind of general. She does a lot more than is what is listed on here. I will say, as does most of the other staff as well, than what's listed, but I didn't want to list everything because that could be several slides. So again, these are, you know, a lot of the different functions that she does. One thing I wanted to mention, electronic permit system administration. That's our LLAMA, our land management software. It's our electronic permitting. She is our kind of administrator for that, if you will. She does the troubleshooting, not only for us, but for other departments that use the system. It's Public Works and Fire at this point. So if anybody's having a problem, those questions or concerns kind of funnel through her. And if she can figure it out, she'll take care of it. And if she can't, she'll move it on to the office support to develop software developer. She's also, of course, just you know, does a lot of the you know, data entry and just keeping things moving within that system. Everybody uses the system, but she's kind of the one that keeps it all moving. Let's see. So I won't go into too much detail, but again, just a lot of different things that she does. We have director function in special projects. That special projects is, as you folks probably know, is just a little bit of everything, kind of all kinds of different things that I know Monty was involved in over his years here that of course I have taken up as well. Again, a lot of different things. It's a little bit challenging to list them all as well. But there's, you know, what's listed here is kind of the overall umbrella of the different things that we do. I will say I'm on a lot of different committees, both in the county and regional agency, and I'm really glad to be on a lot of different committees, just because that's not only is a great way for me being new here to network with people, to meet people, to really learn about what's going on in our region. I think that's always beneficial. But then we can, you know, and then, you know, by extension, folks can be kept, you know, apprised of what's going on in our region, what we need to be involved in, and what's happening, or what we should know about. I think regional planning is very, very important. So I'm really glad to be able to be a member of a wide variety of committees in the region. Okay, so I'll just cover this really quick. I know this is coming on the heels of the conversation we just had about budget, so I completely understand that it's both timely and not so timely maybe, but you know, I think it's always important for you folks and you know, again, the general public to be aware of, you know, kind of what we need based on everything we do, you know, what we might need up there, so we can keep maintaining the excellent level of customer service that my employees really do offer. We have added the part-time clerical assistant, which I do believe will give us a lot of relief and a lot of help, so I'm glad for that. You know, in the future, we probably would want to look at a full-time clerical assistant, and definitely an environmental health specialist is the second one. Harry does all of that on his own, and he's often working through lunch or after hours, just to keep things moving. So that's definitely something we'll be talking about over time. And then of course our space, as with everybody, all the different departments, we're all kind of, you know, lacking in space or needing additional space, not only, you know, for these future staff members, if we can get them at some point, but also space, you know, to welcome this as the public. We are, for the part-time clerical assistant that we'll be getting here in the next week or two, we're going to be expanding our front, where Lisa sits in that front cubicle area. We're going to be expanding that out so they both have room to sit there, but aren't, you know, on top of each other. They obviously both need their space. So that's going to come up into our reception space a little bit. There's still going to be room there. It's not going to be as wide open as it is now, but it's kind of our real only option. So in that kind of sense, you know, we're kind of starting to limit that, you know, that reception area for the public. We can definitely make things work because, you know, we're never going to turn away people by any means, but that's just something to know. And again, planning, and although I'm sure a lot of the departments do, but planning development has a lot of stuff Lots of files, lots of permit folders, documents, maps, all kinds of different things. We have a hard time getting rid of things. We tend to hoard. It's pretty common for planning. And there are, with our electronic permit system that we got a few years ago, a lot of our documents were scanned into the system, which is excellent, but not all of them have been. And there's a lot of information and files and whatnot that haven't been, and we can do that, but that also takes time and staff time to be able to do that. So we're hoping that our new part-time clerk system will be able to help with some of that. So just pointing to the annual report, I don't have that in my slides, that hopefully you all received your hard copies of that. Good. As you can see, our permits and our reviews are generally increasing of course that report was for 2020, and we have a comparison in there from 2019 to 2020 for most of our permits and reviews that we did. And as you can see, most of the work has increased. It's been a weird and interesting year. Generally, planning and development sees a bit of a slowdown in the wintertime when it's colder. We did not see that this year, and I'm not sure we've seen that for the last couple of years, but definitely this year with COVID, I guess everybody figured they might as well get some things done since they were at home anyway. So we definitely did not see a slowdown. And again, for the most part, our work increased. If not at least stayed the same, it increased. And of course, as growth and development occurs within our community, our workload is going to increase as well. Okay. So upcoming, what I'm kind of thinking, over the next several months with you folks, like I mentioned before, I would like each member of my staff to attend a future meeting, one at a time, attend a future meeting to kind of talk more in depth about their tasks and answer any questions you folks might have. Flooding and floodplain education. The flooding week was last week, I want to say. But that's something Steve and I talked a lot about, that's something that's very important to get out there and educate people about this. Because I found even from where I came from and here, other places in between, people don't really understand floodplains and 1% annual chance and all that different sort of stuff. And this is something that obviously we do experience in our community, so it's very important that people are aware of what all of this means and to be prepared for all of that. Comprehensive Plan 101, I'm kind of thinking of again for the next, not necessarily any time immediately soon, maybe summer or fall, as we're starting to think about updating our comp plan. Just kind of, giving everybody just kind of a baseline of what a comp plan is and kind of what we want to do with it. And then any other informational sessions that you folks would like to know about. Again, I'm all about getting information out and making it useful for people. I don't want to just stand up here and talk about something that you don't want to know about or isn't of use to you. So if there's anything that you're interested in knowing at any time, please let me know. Always come talk to me. Let me know what I can do to inform you. So hopefully that was quick enough. It was quick, but gave you enough. So I'm happy to answer any questions you might have.
Anybody?
Very thorough.
Left us speechless.
All right,
Okay.
perfect. Again, you folks know where I am. My email, my phone. Please, contact me at any time if there's anything I can do, and we'll just go from there. Okay. Thank you so much.
And I don't have anything other business right now. I know we've got a meeting in 20 minutes, so,
Yeah. Do they bring us lunch? I can't remember.
no.
Oh.
Yeah, I was just thinking that too. I should have grabbed something, but I didn't have time, so. So what I'll do is I'll accept a motion to adjourn after that law enforcement meeting, because with two of us on there, it's
You
an open meeting.
actually- you actually adjourn now.
We do?
Yeah, that's not part of the Riley County Commission.
Okay. Well, since I haven't gone through that particular part.
That's why I'm not there.
Yeah. Then I'll accept the motion now, and the rest of that is what it is.
Yeah, I'll move to adjourn.
I'll second.
It's been moved and seconded. All those in favor?
Aye.
Good luck at law board. Good week, everyone.
Yeah, you too.
Fill out your brackets.
I already have. I got 2 of them.
Oh, yeah.
2, that's cheap.
They told us in our group we could do 2 of them. So I do a real one where I really think it, and then I do one that's all screwed up. And
What if
9 times out of 10, the one that's all screwed up is the one that ends up winning.
Yeah, I usually do better when I don't analyze it and think about it and research it, you know?
I analyze the one and just kind of mess around with, and we'll see what happens.
That's what works best for me, is not to think about it too hard.
I guess I'll see you Wednesday afternoon, Zoom call.
Which one's that? Yeah.
Yeah.
Yep. I've got so many of those this week, yeah.
I got a few of them too.
Remembered that.
I thought they'd kind of start dying out a little bit, but they seem to be getting more and more. I don't
think
know.
more and more, the more people get comfortable with it.
I think, we're gonna be stuck with that model for a while.
Yeah, I believe you're right. Enjoy law board.
Yeah, I made sure.
Ugh.
Email.
Hmm.